Hello, welcome back to another episode of Honest Conversations with Chin as a Favor. Tonight we have a very, very wonderful topic to discuss, and we have an amazing guest with us tonight who is excited. I, for one, am very, very excited because this is a conversation that needs to be had. It's one that I'd always wanted to have, but I was waiting for the best time, and I didn't want to be the one to tackle some of the questions that I knew would be coming up. And so I decided to wait for the best time, and that time is here because we have an amazing guest in the house. I'm going to give you a couple of minutes so you can go and invite your friends, get them to join. I'm inviting my WhatsApp people, my Facebook people, my Instagram people, anyone that needs to be invited. I am getting them to join here because they need to be here. So get your friends, your male friends, your female friends. Nobody is left out of this conversation because when we are more aware of what's going on in our bodies and that of the opposite gender, we can, really know how to tackle issues when they come up and feel less embarrassed and ashamed to talk about these things because they are bodily issues and really should not be any reason for embarrassment. But when we are not aware of what's going on, we are too ignorant to even care. Well, it's not my gender. Then you are left in the open because you could have a son, you could have a brother, you could have a husband, you could have a friend. And when they have medical issues like this, and you have no idea what's going on, then there is a problem. So you want to be in the know of majority of things that you should know actually. So this is not just for the men, it's also for the ladies. And the men, I hope you're very, very prepared because tonight is going to be amazing, amazing. My guest is already backstage waiting for me to call him up. So I'm saying this so you can go and get people to join. All right. So this is Honest Conversations with Chin as a Favor, where we discuss everything life, everything wholesome living, everything wellness. No, we don't discuss business here. We discuss personal wellness because that's what I'm all about. Your personal well-being is my utmost concern. So if you're watching, please drop a comment and let me know that you're watching so I can give you a shout out. All right, drop a comment and let me know. If Nanya Doctor is here, it's good to have you here. If you're watching, please drop a comment, okay? I'm trying to invite my Instagram people to join. Get your friends, share the link, all right? Share the link and get everybody to join. Ubong, I see that you're here. Thanks for joining. Thank you very much for joining. It's a pleasure to have you. Who else is on? 6 people are watching and I can see only 6 comments. Let me know that you're watching, all right? Stephen Oka, good evening. I'm glad to have you here. Now go and invite your friends. You don't want to have this conversation alone. You don't want to witness this conversation or watch it alone. You want to get your village people, your enemies, your friends. Everybody should come and join and hear. Right? Miracle Oluwatobi, I see you. Thanks for being here. It's good to have you. Who else is here? Glorious Emmanuel, thank you for being here. It's a pleasure to have you here. Who else is watching? We have 5 people watching. Go and invite your friends. So go and invite your friends. In few minutes, we'll be going full throttle on the conversation and we'll be bringing our guest in few minutes. So go ahead and get your people to join. Get your people to join. If this is your first time joining Honest Conversations, please let me know so I can share Zobo with you, all right? Who is in for an adventure, for an expository conversation? Tonight, we are not bearing anything. We are not keeping anything out of the table. If you were here with us last week when I discussed with Dr. Lillian, everything was talked about. just as it is. Just as it is. And that is how it's going to be today. The only difference is that we are not focusing a lot on personal hygiene here. Our men, we need to talk. And that's why this conversation is here. All right? We need to talk. So get your people to join. Man, as well, I see that you're here. Good evening, Favor. Thanks for hosting this program. Looking forward to what will be discussed. Oh, you'll be mind blown at what will be discussed. Nwanyi Young, I see that you're here. It's good to have you. Who else is watching? Get your people to join. Once it is 10 minutes past 9, we get this started. So we have just 2 more minutes to go. Get every one of your village people to join. Yes, village people are welcomed. Get everyone to join. All right? And if you have any question and you're comfortable dropping them here in the comments, please go ahead and do that. All right? There is no shame. There is nothing to be embarrassed about. I mean, this is a community, right? This is a place where we discuss majorly many things that people are not comfortable discussing. So we are a community here. We are a family here. So you are free to drop your questions and your comments and everything in between. It's going to be fun. I have no doubt whatsoever. All right. Just 2 minutes more to go and we'll get started. All right. If you're on, please drop a comment. I'm trying to invite my other family and tell them that we are live. Have you invited anyone to this session? And some of you might be asking, why did I choose to have this conversation? You know, last week, after discussing with Dr. Lillian and having that amazing conversation with her, some of the men here were advocating that I should host another one for them. I should host their own. I shouldn't leave them out. So we are here. We are here because many men don't pay attention to their health, and it's a very serious cause for concern. That is how we get, you know, we keep hearing that this person died, this person is walking and died, this person just, you know, slumped out of nowhere. It's really not out of nowhere. They just haven't been paying attention to their health. And I've seen that women are more likely to see a therapist or see a medical doctor than men are willing to do. And we're going to be discussing all of those things today because this is life that we are talking about. It's not like because you're a man, you have a different life, or you know, you have more lives than women do. So we are going to be discussing all of those things here today. So if you have any questions and you're comfortable dropping them in the comments, please go ahead and do so. We have a medical practitioner here who will be answering all of your questions real time, okay? So it is time to get started already. All right. So quickly, let me read up the bio of our guests so that you know who will be speaking with you today. I'm very excited for this one because this guest of ours is fire. Just get ready. Get ready for let me not say anything. He said it himself that you people, I'm not going to spare anything. He told his audience that he's not going to spare anything. So if he told you he's not going to spare anything, just get ready to have all and every conversation with him. All right, so quickly, let me read up his bio so you get to meet him and know who he is, what he does, and why you should listen to him. All right, so our guest is Dr. Newton Enyimba, and he's the founder of online clinic with Dr. Newton. Okay? He's a trained medical doctor with postgraduate medical certifications from the University of Washington, Stanford University, and the Postgraduate Institute for Medicine, PMI, USA. Oh my goodness. Say bio now. He's the founder of the online clinic with Dr. Newton, a Telegram group where he offers free round-the-clock healthcare support to people from around the world. He's a medical officer with the Benin Medical Center, BMC, as well as Ayolik Medical Center, Benin City. He is happily married to engineer Dr Newton Enyimba, and their marriage is blessed with a son. This is what I call bio. Our guest is loaded. Very, very loaded. So let me see your comments before I bring up our guest. If you're excited, please drop in the comments that you are excited. I, for one, am very, very excited to learn from Doctor, because some of the questions that I have here, I don't have answers to them. So I want to learn from a medical practitioner. Let me see what you have here. Faith Pence, you're here. It's good to have you. Bro Joe, you are always here. It's good to have you. Michael Ekenam, you're here. It's good to have you here. Faith Pence says, I'm excited to learn from Dr. Newton. I know, right? I am very, very excited to learn from him too. For some reason, he was backstage some minutes ago, but he's no longer backstage. Maybe his network is, disturbing. So let's get talking while he tries to reconnect. All right. So tonight we'll be discussing several things ranging from cancer to let me see the questions that I have here. We have questions on cancer. We have questions on sugar and fertility. We have questions on diabetes. We have questions on mortality rate. We have questions on suicide rate. Oh my goodness, this one is a very big question. And I hope that while we get into this conversation, we're going to have a lot more in-depth conversation on this. Okay, so our guest is back now. And with a clapping ovation, guys, welcome Dr. Newton. If I don't see your clapping ovations, I will not bring you up. Ha! Give me your clapping ovation. Let me know that you're excited to have Dr. Newton. I, for one, am too excited. I've been waiting for this since last week. You have no idea. Let me see your clapping emoji. Give him a clapping ovation. Yes, I can see that. Okay. Okay, so you're excited to see him, huh? All right. Dr. Newton, you are very, very welcome. Good evening, sir.
Thank you very much, Nasa. You're flattering me here.
I'm not flattering.
I'm very excited to be here. It's my pleasure to be here. I'm glad to join you on your show. Thank you very much.
It's such an honor. You have no idea. It is such an honor to have you here. Thank you very much. Thank you. I've already introduced you. Is there anything else that you want us to know about you? Maybe a fun fact about you?
Well. I think everything that will be known about me is already known. There's not much to be known about me.
Okay.
I already feel overhyped.
Okay, I can see the comments. Everyone is excited to have you. You're very welcome, sir. So, like I said before I brought you up, there is this problem that men have.
Yeah.
They don't like visiting the hospital. They don't like going to see the doctor unless it's life-threatening. They are always, I don't know if it's as a result of the conditioning of the society from when they were young. You're a man, you're supposed to be strong, you're supposed to man up. So when they feel, low, when they are sick, they feel like they need to continue manning up. Or I just don't get it until they are down completely before they see the need to go to hospital. I mean, why is this happening?
Well, it's common among men, like you rightly mentioned. It's common among men, and it's just a behavior. All right, it's just an attitude we have And I'm saying we because I'm also part of the men folk. First of all, thank you
Yeah.
very much for the question, and I'm glad to be here. I hope we have a great time sharing
Oh,
and
I'm very sure.
communing. Yeah, so it's a general idea. It's a general behavior men have generally. We don't have this attitude to we don't want to seek help. All right, we don't want to seek help
Mm.
until it's too late. In fact, we don't even want to let you know we are sick. We don't even want to let you know we are going through some trouble. We don't even want to. We just feel we don't want to disturb anybody with our problems. Okay.
Mm.
Not because I'm a doctor, but I think it's also the main factor that's affected because it happens to me too.
It's
I,
yeah,
I
it's a
can
main
I can
factor.
I can tell how many times I can't count how many times I've had to treat my wife and all that. But when I'm sick, it's like I just don't want to disturb you with my issues. Or I don't want you to
Wow.
be panicking, stuff like that. So I may be so terribly sick, but I try to handle it and manage it myself and all that. But the part that is bad is when we don't want to seek help, medical help. Okay,
Mm.
when we don't seek medical help. For instance, you see people in the hospital, when you see patients in the hospital, about 60 to 80% of them are women. Women, the moment they have a problem, they want to come to the hospital, they want to know what is happening, they
Yeah.
want to know how to solve it. But men are not like that. Men, we just have, and another thing is we have this poor health seeking culture. All right, it's
Mm.
just a problem with us, and it's really terrible, really. But maybe it's just, what will I say? Maybe it's just a societal something, because men are expected to man up, men are expected to be the solution providers. It looks like
Yeah.
if you're out there seeking for help, it's like you're incompetent or stuff like that, and that also adds to why most men die faster, all right, than women,
Mm.
as it were, because it's just a poor health seeking culture. It's a poor health seeking culture, and it's so bad, really, so
So
bad.
what can we do about it? Like, how do we raise awareness for to tell men that it's okay to seek help when they are sick or when they are down? Shall we even get to that point where men are able to seek help for real? Because even their wives sometimes don't even know what they're going through unless they are now terribly down, before they open up. Like, can we ever get to that point where we feel, where the men folk is, are able to seek help? Because I think society has conditioned them to feel like they are demigods, they are superhumans, and so whatever that they are feeling, whatever they're going through, they just have to bottle it up within themselves. I saw a video some time ago, and I saw it today again. And someone was saying that when you ask a man how he's doing, and he says, I'm all right, that he's not all right, that man is
Yeah,
going
yeah.
through
I actually
stuff.
shared it on my Facebook wall today
Oh, okay.
because that's
So it's
basically
it's
the number,
disturbing.
the average man for you.
It's disturbing. All right, so let's quickly get on to the questions that we have today. All right. The first one that I have here is, at what age can men start checking for prostate cancer?
Okay, prostate cancer is first of all, let's understand. Before I answer the question, let's understand what prostate cancer is. For those of us who don't even know what it is, all right. A lot of guys, they know men have prostate cancer, but they don't know exactly where the prostate is or what organ is referred to as the prostate and all of that. All right, the prostate is basically a walnut-sized gland. All right, it's a little gland like that. All right, it's located at the base of the bladder. Okay,
Okay.
if you look at the male reproductive system, it's located at the base of the bladder. All right, and
Okay.
it connect attached to it is the vas deferens. Okay, if I don't, let me not bore the audience with all of these medical terms and all that. But the major job of the prostate is to produce seminal fluid.
Okay.
All right. That's the major job of the prostate. It produces seminal fluid. Seminal fluid majorly nourishes and transports the sperm cells. Now, this is very
Okay.
important because when a man ejaculates, all right, some people say when a man releases, when a man comes, all right, all of it. So when that happens, what we produce, what we bring out, what we emit is not sperm, it is seminal fluid.
Okay.
The whole of that thing that comes out is seminal fluid. Inside it is where you find the sperm cells. You can't see it with
Okay.
your physical eyes. You have to look at it in the laboratory under a microscope. So that
Okay.
is what. So that liquid portion of it is produced by the prostate. That is the job of the prostate, to produce that liquid that carries the sperm cells out. All right. So it does that function throughout a man's life, basically. All right. It does that function throughout a man's life. But when you start approaching 45, 50 years, particularly, you have to start screening for prostate cancer. Prostate, that's the pronunciation. Prostate cancer. You have to start screening for prostate cancer from 50 years. In other words, your
50
fifth decade
years.
of life. Yes. You have to start
Okay.
screening. You have to do some tests like the PSA, prostate specific antigen. All right. Sometimes if we think there's a problem, we may go further to do a prostate biopsy. All right, and all of that. So
Why is it
when we do,
important to go for
yes, very
the
important.
test?
That's a very important question because when you do it, it helps us identify the early stages of prostate cancer.
Okay.
Because you see, prostate cancer first starts as a hypertrophy or an enlargement of that prostate gland.
Okay.
That is the first thing that happens before you progress to prostate cancer. There will be an enlargement of that prostate gland. Medically, we call it BPH, benign prostate hypertrophy.
Okay.
So when the doctor gives you a diagnosis of BPH, it does not mean you have a prostate cancer. It just means your prostate gland is enlarged. And that means your risk of developing prostate cancer later on is more increased.
It's more increased.
Yes. So if we do that prostate examination, all right, there's what's called a prostate examination. We do it by doing what is called a DRE, a digital rectal examination. You would have come across those kind of examination where the doctor has to stick his finger or his or her finger, into your anus, into your rectum.
Mm-hmm.
Okay,
Yeah.
it's a very uncomfortable examination for most men, but we use it to examine the prostate to see if it's enlarged. So it's important to start doing those tests, to start doing those checkups from the age of 50, because from that age, the prevalence of prostate cancer skyrockets.
Wow.
So when
I
we
have
discover
this.
the
I
early
have.
stages of prostate cancer, we're able to, take care of you, basically.
I have an older friend who is about 48, 47.
Yeah.
And for some reason, he has enlarged prostate, like you said. So when he went to the hospital, just the way you said it, they were concerned that he might, develop cancer later on. So he had to go different places, conduct different tests to be sure that he is good. So I hope that 50 is just the average, right? They can start early,
Yes.
like 45, or
Yes, you can
is
start
or
early from 45. In fact, I
when they
advise from
notice that.
45 years.
Okay.
Yes,
Okay.
I advise from 45 years. You should start checking. All right. In fact,
Okay.
ideally, medical checkup should be done yearly, annually. But
Ah.
yeah, specifically,
In Niger.
specific in Nigeria, that's the problem. We don't have that. We don't have that health-seeking attitude. All right,
Yeah,
it's
we
not part
don't.
of our orientation, and that's a problem. That's
Yes,
a major problem.
it
That's why
is.
many of
I
the cases
agree.
that come to us in the hospital comes as advanced cases. All right, and many times there's little or nothing you can do, because in our culture, we will first, when somebody is sick in our culture, you first go to the chemist. All right, then they go to the pharmacist, then they go to the lab to do some tests, then they go to some prayer house, then their friend somewhere tells them about somebody inside the village, then one other relative now tells them that, oh, the husband of my friend, it was this thing they gave him and he drank and he was okay. Let's go there. You see, all this moving
Yeah.
around, time is wasting and money
Time
is
you
going.
wasted.
So that's the problem. So 50
So by
years
the
is
time they
perfect
come to the
to start checking for
hospital,
prostate.
it's
It's already late.
bad. And then
And
we
then
keep
they are
saying
now,
that our health, that our doctors are not good enough. Meanwhile,
that's
you're
the
the one who
problem.
came in when it's already bad. Yeah.
Exactly. And they now act like their lives are in your pocket or something, like just put your hand in your pocket and give them their lives or something. But you've been carrying this thing about for several years and you didn't
Yeah.
think it's necessary to seek. So I tell some patients this, okay? I tell them many times I'm not so sympathetic towards many of them who do these things. And my reason is simple. You came to the hospital finally. What it means to me, all right, in my practice, is that you know the right thing to do. What it means to me is that you actually know the right thing to do, but you chose to go around looking for help where there is no help. And when it was finally obvious to you that there is no help, you now came to the hospital. So, I mean, that's the problem.
So the hospital is more like the final bus stop instead of the
When
first
it is
line of.
supposed to be the first point of call.
Yes. Please, oh. This is not just to the men alone. Oh. So the women, we don't really go to the hospital when we feel we should. We go to the chemist, the pharmacist, just like that before we go to the
Before they
hospital.
finally
And
land in
that's
the
very
hospital.
detrimental. That's very detrimental to our health. Doctor, the next question that I have here is very, very important.
Yeah.
Very, very important. And that is sugar consumption.
Okay.
I see so many men. Oh God. I see so many men gulping soda, Coke, Fanta, Sprite, Tim, all those soda everywhere. If they're under the sun and it feels like it's too hot, they just carry, hey, madam, bring it. And they gulp it down with gala most of the time. So I don't know, doctor, are there side effects to high sugar consumption in men? Are there ways that consuming sugar in large quantities can affect men? Because some of them can take these soft drinks like every day. Some of them even take it about 3 times a day, all through the week. What are the health risks to such diet?
Okay. Very important question. The issue of sugar. The issue of sugar, okay, is something that has been a topic of debate, all right, as long as I know. But here is where my argument always lies, okay? Many
Okay.
people will say, many people will say, there is this popular saying, first of all, that sugar causes diabetes. And I always like to debunk that because
Okay.
not just that I don't, it's not just that I don't believe it, but it is not true. I mean,
Okay.
theoretically, when you consider what diabetes is, sugar in itself does not cause diabetes. Because when you
Okay.
say it causes diabetes, it means that people who take sugar will have diabetes because of the sugar. And I said no. All right.
Okay.
Sugar will predispose you, eating excess of sugar, soda, and all of that will predispose you to obesity. All right.
Okay.
It will predispose you to obesity. Obesity can cause diabetes, or let me use the correct word medically. It can predispose you to diabetes. Obesity can predispose you to heart diseases. Obesity can predispose you to hypertension. Obesity can predispose you to infertility. And I can explain all of that process right now, okay? But sugar in itself does not cause diabetes.
Okay.
The reason is simple. I believe the audience can hear me. Let them borrow me
Yes.
their imagination for a moment, all right? What is diabetes? You have poor glycemic control or poor blood sugar control. all right, poor blood sugar control, resulting in persistent high blood sugar. That's diabetes simply. In other words, this person has high blood sugar because the body is poor, is metabolizing sugar poorly. The body is digesting sugar poorly, or the body's capacity to digest sugar is very poor. That is why this person has high blood sugar. It is diabetes. Now, there are two types of diabetes, two types, or they're actually a broader category, but this is the major category. All right. So let me not bore our audience with all the other medical jargons involved with diabetes. But the two major types you should know are type 1 and type 2. Everybody knows that. Type 1 diabetes, type 2 diabetes. Type 1 diabetes, we call it insulin dependent. Type 2, we call it insulin non-insulin dependent.
Okay.
Type 1 diabetes, how does it happen? Remember, I'm trying to say that sugar does not cause diabetes. And I said, if we understand that to understand that statement, we have to understand what is diabetes, which I explained. I said diabetes is high blood sugar level because the body's capacity to, metabolize sugar is very poor. So I said there are two types of diabetes. Let us know the causes of these two types. The first one is diabetes type 1. All right, it's popular. It's common usually in patients who are less than 30 years old. Now, what causes type 1 diabetes? When you eat sugar-containing foods, carbohydrate foods, they are broken down to glucose in your stomach. When you eat bread, rice, yam, whatever, beans, they are broken down to glucose in your stomach by digestive enzymes. That's simple enough. This glucose enters your bloodstream. When it enters your bloodstream, it is transported to the target cells, your brain, your liver, your kidney, your muscles, because this glucose, remember, it is a fuel for bodies, for the cellular function.
Yes.
So this glucose that has been broken down in your stomach enters your bloodstream, then it is carried to these body cells, your liver, your brain, your liver, and all of that. When it gets to your body cells, glucose does not just jump into the cells like that. That is where insulin comes in. Insulin acts like a transporter, like a woman carrying a baby on the back. The woman is the insulin. The baby on the back is the glucose. Without insulin, glucose cannot enter the cells.
Okay.
So it is insulin that backs glucose and carries glucose into the cells, where glucose now drives cellular function, where glucose functions as a fuel to make the cell function and all that. Now, in type 1 diabetes, there is no insulin.
Okay.
Because the cells that produce insulin in your pancreas have been destroyed, either by autoimmune diseases or genetic disorders. So somebody is diabetic. What diabetes does he have? He has type 1 diabetes. The cause of that type 1 diabetes is because insulin is absent in that person. That person's body is not producing insulin.
Lots of sugar.
So not because of sugar. Sugar is not the problem. Yes, the person's blood sugar is high, but there is a reason why that blood sugar is high. The blood sugar is high is not because the blood sugar is high, not because the person is taking sugar, but because the person does not have that insulin that will carry that sugar into the body cells where they will be used. Because it is when insulin carries the sugar into your body cells, then the sugar in your bloodstream drops. The sugar level in your bloodstream drops. You ate the food, it was digested, broken down to glucose. Glucose enters your bloodstream, your blood sugar rises. Insulin comes along, carries the blood sugar or the glucose into the cells, and the blood sugar comes down to normal. So that is what causes type 1 diabetes. There is no insulin. What of type 2 diabetes? Type 2 diabetes is the most common diabetes available. In fact, when people tell you, oh, my mother is diabetic, my father is diabetic, it's most often, almost always type 2 diabetes. In that type 1 diabetes, the treatment is to be giving that person insulin. We don't give the
Insulin.
person tablets, we give them insulin because that is what they lack. In type 2 diabetes, which is the most common, of course, is seen more in patients who are above 30 years old. Most of our grandmas and grandpas in the village say it's diabetic, she's diabetic, it's most likely type 2. It is called non-insulin dependent. In other words, it is not dependent on insulin.
Okay.
But what happens in that situation? Insulin carries this glucose now from the bloodstream and comes to the cells to put to carry the sugar or the glucose into the cells. The cell says no. So another name for that type 2 diabetes is called insulin resistant diabetes. In other words, the reason is because the body cells are saying no to what insulin is giving them. Insulin wants to come with glucose. Body cell says no, we don't want you. And glucose cannot come in except insulin brings him in.
Oh, wow, it's making sense now.
So you see that glucose cannot come in except insulin brings him in. So when the body cells are saying no to insulin, they're also saying no to the sugar. Is it clear now?
Yes,
the body cells are saying no to insulin. The body cells are also saying no to the glucose. So when the body cell says no to glucose, what does it mean? It means this glucose, this sugar will remain in the bloodstream. So the blood sugar will remain high. So it is called insulin resistant, meaning the body cells are resisting insulin. So there are a number of factors that can predispose you to this type of diabetes. It is not sugar. Number one factor is a genetic predisposition. Are you still with me?
Okay.
A genetic, a genetic predisposition. And what that means is, if diabetes is in your family, this type 2 diabetes, if it is in your family, it means your chances of having this same type 2 diabetes is increased. That is the genetic predisposition, because it is genetic in it runs in your family. So you most likely inherited that gene.
Okay.
Second thing is what I mentioned earlier, obesity. People who are fat, people who are obese, have a higher chance of becoming diabetic than people. This is why we always talk about keeping fit, weight loss, weight loss, weight loss. I mean, it's not just about the diabetes. Obesity predisposes you to hypertension. Obesity predisposes you to everything. A lot of things. Even autoimmune diseases. Obesity predisposes you to infertility. What else can predispose you to this type 2 diabetes? Smoking. Another thing is alcohol.
Anybody that the effect of those substances. But I think there are some questions here. There's a question here that contains that already.
Okay.
When we get there, we're going to treat that.
Wow. Okay. So anyway, let me not go ahead of myself.
I honestly did not know that sugar does not cause diabetes. I did not know. So it's okay to consume as much sugar as I want.
That is the point. It is not okay to consume sugar carelessly, because I said that
because say no, doesn't cause that.
That's the point. People would not say, okay, he said it's just I'm just trying to correct that cliche. All right, that popular saying, sugar causes diabetes. Don't take sugar because it will cause diabetes. No. When you take excess of sugars, especially all these unrefined sugars, all right, what it does is it predisposes you to that obesity.
So it makes you. It brings you to a place where you are now more prone to have this.
Exactly. Okay. That is what it does. Okay? That's what it does. So for the men, you have excess tummy fat. And besides tummy fat, you have even a lot of obesity and all, excess fats accumulating and, storing. And when we talk about obesity, it's not just when you see somebody and doesn't lose fat in your eyes.
Yes.
Yes, you can be
That's right.
obese, but you don't even look as fat as you're expecting yourself to look. Let me explain that. The only way you can tell somebody is obese is not by looking at the person. Yes, there's some people you look at and you can tell this one is a mass. Yes, but there are some people you look at, you may not necessarily be able to say they are obese, but we can tell that they are obese because there is a way to calculate it.
I was going to
It's
ask
called
that.
BMI, the body mass index.
Body mass index.
BMI, which is calculated by your height over your weight.
I hope you have your pen and your paper, guys. Your height over your weight.
Over your weight.
Okay.
So when we calculate it, we're able to know when that calculation. So you must find out your height, then you must find out your weight.
Okay. Your height over your weight. I'm putting it down for you guys just in case you forget before we go on.
So that's it. When you find out that your height and your weight, and you do the maths, okay?
Wow. So, are you with us, doctor?
Are you still with me?
Yes, but you are frozen. Your visuals is frozen.
Hello?
Yeah, we can still hear you, but your camera is frozen.
Can you see me?
Yes, we can
is
see
it okay
you
now?
now. Yes.
Okay. Yes. So when we do that maths, so your height in meter square over your weight in kg. Height in meter square over weight in kg. When we do that maths, if your own, if the result you get falls between 14 to 24.5, then you have normal weight.
Okay.
If it falls between 25 to 25 to 29.5, you are overweight. Okay.
Not obese yet.
So that is it. Then if it falls between 39, 30, all right, 30 to 39.5, you're already obesity type 1. Then 40 and above is morbid obesity.
Morbid.
Morbid obesity. That is what it is.
This is serious.
It's a very serious matter. So you see, what I'm trying to say is that you now have somebody who is looking normal, but that person is obese if you use this calculation.
Is obese.
The person may be obese because if you fall between, like I said, between 25, right, to 29.5, you're already overweight. You are already overweight. Of course, if you're less than 14, you're underweight.
I check mine.
So this is important.
I need to go and check mine. Wow.
So being obese is not something you look at yourself and say, I think I'm getting too much weight. It's not true. Or I'm fit. You may be looking fit, but you are obese.
Yeah.
Yeah. So you need to
and you might be thinking that you need to add weight. Meanwhile, you might be thinking that you need to lose weight. Meanwhile, you are already underweight. So the best way is actually to know your weight.
You must your weight and your height. Calculate this. Do this calculation exactly.
Wow.
So that is how we can tell.
Wow.
So, like back to
New
what we're saying,
knowledge
it's not that you
added.
consume sugar anyhow, but you still consume with moderation because it has its own what it can predispose you to, which will now cause many other
Consume with
problems.
sense.
Yes, exactly.
Yes. Okay. So, doctor, does diabetes have any effect on fertility?
Absolutely. Diabetes has effects on everything about your life. I mean, first of all, there's a say medically, when you're diabetic, all right, diabetes, hypertension, they are considered chronic disorders or chronic diseases.
Wow.
Okay. And when once you have a diagnosis of either of these two, if you have a diagnosis of either of them, many times they even go together. Somebody is hypertensive, person later will become diabetic. You see somebody who is diabetic, later the person becomes hypertensive. Many times they go together. So
Wow.
there is a saying that if if once you have this diagnosis of diabetes or hypertension, if the disease does not kill you, it will follow you to the grave.
So that means it's not curable.
Did you thank you? It is not curable. That's why prevention is usually better than cure. But however,
Wow.
even if the diagnosis has been made, it is still not a death sentence. It is still not a death sentence. It can be managed. Managed. So you
Effectively.
have to, yes, it can be effectively managed. You have to be on your drugs daily. You must be on your drugs daily. And then there are some lifestyle modifications you must employ. So I'm trying to answer your question that does diabetes have any effect on your fertility? Yes, it does. When you're diabetic, it means you have persistently high blood sugar levels. One thing it does, all right, is that it causes deposition of glycated materials. Glycated means glucose materials,
Okay,
glucose
thank you for breaking
byproducts.
that down.
Okay. Glucose byproducts in the walls of your blood vessels.
Okay.
That is one thing diabetes does. And this is majorly the basis of the destruction that diabetes does to the human body. This thing I just said now. We're telling you don't avoid diabetes, avoid diabetes. This is how diabetes starts its problem with you. Once you're diabetic, the sugar level is persistently high. It now causes gradual deposit. It will be depositing gradually. Glucose byproducts will be depositing in the walls of your blood vessels. Your blood vessels are this is the caliber, for instance. You know, they're like pipes, okay?
Yes.
Transferring, carrying blood to different parts of the body. Your blood vessels, your arteries. It starts depositing on the walls. What happens to the caliber? Gradually, it narrows.
It gets thinner, yes, narrow.
And when it narrows, what happens next? Blood flow is impeded. So before this
hypertension is
particular,
inevitable.
good, you see it now. You see where the hypertension factor comes in. That's why I said many times they go together. So this blood vessel originally carries maybe 5 mils of blood to this organ. Now, because of those glycated products depositing on the internal surface, causing reduction in the caliber, now it's only able to deliver 1 mil of blood to this organ. What do you think will happen to the organ? The organ starts to suffer. When that happens in the brain, you start having things like stroke.
Yeah.
When it happens in the heart, you start having things like myocardial infarction, leading to heart attacks. Of course, you start having hypertension. When it happens in the nerves that controls the hands and the legs, they start telling you things. They start talking about paresthesia, tingling effect. Diabetic patients will tell you that when they match their legs on the ground, it doesn't feel like it's their leg. It feels like they're matching on foam.
So sometimes Doctor, let's talk about this. So sometimes it happens to young people. Like, I don't know if it's okay. I experienced that this evening when I got up to do something. My leg didn't feel like my left leg. So is it okay?
No. That's not the only.
Is
No, tingling effect happens sometimes. Okay, that kind of
okay.
numbness. It happens sometimes when there's nerve compression. All right,
Okay.
let's get that clearly. Yes, there's nerve
Okay.
compression. Yes, maybe you've been sitting for a long time, or
For a
you
while,
folded that leg for
yes.
a long time, or you were carrying a weight on that leg for a long time. You see that. So those kind of
Okay.
things can lead to nerve compression, and usually temporal. All right, it doesn't.
Hallelujah.
Yes, it's not.
Okay.
It doesn't last. Yeah. So it
Okay.
doesn't last. Yeah. So you notice after a while, especially when you move around and all that, and many times not just the
It
nerve
gets
compression,
fine.
but
Okay.
even there's occlusion of blood flow to that part of the limb.
What is occlusion?
Like maybe for instance you were carrying a weight on the leg or something. The blood it may compress your blood vessels. Okay.
Okay.
Or maybe you've been
That
sitting. You've
that's occlusion, right?
That's
Because my
occlusion.
audience are
Yes.
not medical
Okay.
students. Okay.
So that's occlusion. So it may compress the blood vessels and all that, and you have
Okay.
and you have decreased blood flow to that leg. That will cause all those numbness and tingling effect, like you have pain. It is as if they feel
Mm-hmm.
pain on the legs and all that. Yeah.
Yes. So
So, but,
yes.
yeah. So, but for diabetics, it's chronic. It's there for a long time. It's there almost throughout their day, throughout the week, like that.
Wow.
They will tell you they are marching
Wow.
on their leg. But what is happening in their case is not what is happening in your own case. In your own case, it was a temporal nerve compression or a temporal blood, cessation of blood supply to that leg, which when you relieve that leg, walk around for a while, it eases off. But in their own
Mm.
case, these glycated products I mentioned earlier, glucose products, are depositing in the wall of the blood vessels that supply these nerves. Remember, even nerves are supplied by blood vessels. They need blood to survive too.
Yes.
And many times, these glycated products find a way to be deposited on the nerves themselves, thereby
Wow.
inhibiting conduction. So the nerves usually, you see, this my fingers now. I'm able to flex and extend, open and close. Okay,
Mm-hmm.
is basically a nervous function. The nerves are conducting, sending signals from my brain that, oh, I want to open my hand, I want to close it. Okay, so that's what happened in their legs. In their case, these glycated products are deposited on the nerves itself or deposited on the blood vessels that supply those nerves, letting blood flow to the nerves. And when blood flow to the nerves are limited, the nervous function is also diminished. So they have all those tingling effects. So
Okay.
I'm just trying to give you the different effects of diabetes, especially for men. Erection is basically a blood flow issue. What happens is that blood flowed into the penis.
Okay.
To the penis. The anatomic structure of the penis, okay? Three different arranged such that you have two on top. So under, so two are on top like this, and there's one under. All right. So when blood flows into this, the muscles they're like a sponge. Think of a sponge, the way your sponge soaks water. So when the man is aroused, blood flows into those muscles that are like sponge. The sponge absorbs the water, all right, and swells up.
Okay. Wow. I'm doing lots of learning and unlearning here. Lots of learning and unlearning. Let's have our guest back.
Okay.
Welcome back, Doctor.
Thank you. I'm sorry, I don't know what happened, but so these muscles absorbs this blood the penis is standing now. But now, the blood vessel, this patient is diabetic, so these blood vessels, what happens? There's diminished blood flow.
We can't really hear you, and your voice is jumping. The words are jumping.
Okay. Can you hear me clearly now?
I think it's better now. Yes.
It's better now. Okay. So
Yes.
I said if the person is diabetic, okay, are we together? Okay.
Yes.
The person is diabetic, so those glycated products are now deposited on the blood vessels that supply the penis.
Okay.
That will now cause diminished blood flow to the penis and consequently erectile dysfunction. That's why diabetic patients with most times we have erectile dysfunction, also known as impotence. So the point I'm trying to make, there are many causes, there are many problems associated with diabetes in the body, not just the infertility part. Even in the kidneys, you have kidney failure after it's deposited on the renal arteries over a period of time. All right.
Wait, so diabetes can cause that too?
Yes, diabetes can affect the kidneys. Yes, it can affect kidney function.
Oh my God.
So diabetes affects almost all the organs you can think of in the body. Diabetes is horrible. Wow. The same goes for hypertension. They are horrible diseases. So that's why once you are diagnosed with them, two things. First of all, your drugs must be taken every day. Secondly, lifestyle modifications, which I'll probably talk about as we proceed in the conversation.
Wow. Woo! Okay. We're just getting started.
That's a lot,
and
I guess.
I'm already sweating. So much value here. Oh my God, this is just like, it's as if we're in a medical class and we are being taught. That's what it is actually. So many unlearning. To do. I've unlearned many things actually.
Yeah. Hello. Hello, can you hear me?
I can hear you. I'm so sorry. A call was coming in, and if I didn't pick it, the person would just keep calling and calling.
Okay. It's okay.
Wow,
I just
if
wanted
you
to be
have
sure it wasn't
learned
from my end.
something, please comment. It wasn't from your end. Sorry about that. Sorry, guys. Please let me know if you are learning something. Doctor, this is very, very expository. Thank you very much. Someone asked you a question before, but for some reason I can't see the comment anymore. He was asking about prostate cancer, and he said, is it hereditary?
Yes, there is a genetic side to prostate cancer, yes. If it runs in your family, your chances are increased. If it runs in your family, your chances of having it increase. So that's even the more reason why once you clock 45, start going for a prostate checkup.
Okay, and another person also asked, are there lifestyle, can one's lifestyle lead to one having prostate cancer?
Yes, some things you do. Two major things, in fact, to begin with. First of all, a smoker has a higher chance of having prostate cancer than a. Secondly, is alcohol. Developing prostate cancer in later life than somebody that does not drink alcohol and smoking. All right. So then, of course, you have to take care of things like urinary tract infections, even sexually transmitted infections. Having them repeatedly or long-standing or poorly treated sexually transmitted infections or urinary increase your chances. Poorly treated or long-standing or recurrent urinary tract infections and sexual tract infections, they can increase your chances as well. But number one, topmost on the list is genetic factors, which is if it runs in your family, it increases your chances. If you're a smoker, get ready. If you're an alcoholic, you love consuming alcohol, kudos.
If you're a smoker, get ready.
So that's just the truth.
Wow. Okay, let me quickly give a shout out to those ones that are joining us newly. Jenny Bright, I see you. Victor Chibuna, I see you. Gozel Demba, thanks for being here. Godfrey, you are late and you are still here. Thanks for joining. Lucky Nathan, thank you for being here. Let me see Victoria. Thank you. Michael Ekanem, you've been here since, right? It's good to have you. Kellison Concepts, thanks for being here. I see your wonderful contributions in the comments. Thank you very much. Doctor, the next question that I have here is, let's talk about, it's an embarrassing question that men have, but they don't really know how to ask or who to ask. And so they're very insecure about it. So the question that I have here is, when does size of the penis become a concern, a cause for concern? Is there an average size? You know, when does it become a concern? Because so many men, like, am I too small? Am I too big? Am I even average and all that? Doctor, please, let's talk about that. Man, please open your ears.
Okay.
I know you will not want me to. You will not ask me this one, but I'm asking it. Please, doctor.
Yeah, I guess. Well, the size of the penis, okay. I read a study. I came across a study that, you know, actually looked at that issue, size of penis. Does it really matter?
Okay.
And when they're asking if it really matters, they're looking at in sexual intercourse. Okay. And
Yes.
the study actually identified that most women think that the size matters. Okay. In terms of sexual satisfaction, that the size of the penis matters. Most women think so. But generally, in theory, it actually doesn't matter. What matters the most is the use. I mean, we're not talking about very tiny penis. You know, some people say it's pencil size and all that. Those ones they're clearly an abnormality. Okay, there are abnormalities associated with that.
That's what I'm asking. When does it become a concern?
Yes, of course. If it's really very tiny, there are some people you see there's it's a genetic disorder. Is a developmental abnormality. It's not their making. All right, it's a developmental abnormality, and of course, if that is the case, there's really little we can do to help. Okay, it's basically in the domain of plastic surgery, but even in that, there's not much they can do to increase your penis size, because the truth is your penis actually stops growing at the age of 21.
Oh wow.
Yes.
Okay.
The penis actually stops, and I think guys have to free themselves of this issue. The use of a penis is usually more important than the size of the penis. Many ladies will agree with this. There are guys who have very big penises and they are horrible in bed. Well, I'm saying it like this because that's actually where the concern lies. Okay, I've met a couple ladies who have said the same to me. Oh, they had this guy and you know, his penis is so big. They thought they would have a great time, and he just doesn't even know how to use it. He's putting it here, he's putting it here, he's hitting here, he's hitting haphazardly. So
the use is actually more
the
important.
use, yes, the use means the skill. I'm not a sex therapist, as it were, but I'm giving you my knowledge from the medical angle. The use of the penis is more important than the size. It's not about how big it is. It is about how effective, how skilled is a man or is the man in using his penis to satisfy his woman. Because the truth we must come to terms with is that sexual arousal and satisfaction in men is actually different from sexual satisfaction and arousal in women. While a man will want sex 3 times a day, a woman will want it once, because sexual urge in men is 3 times that of women. I mean, this is on the average. There are, of course, there are women who have very high sex drives and all that, but this is generally. Libido in men is 3 times that it is
Doctor, you
in
know
women.
what? I'm going to invite you and Dr. Lillian so we can have a proper sexual and reproductive session.
That's perfect. That's
and
nice.
we can go really deep into this, because I mean it should be a topic of discussion
On its own.
It shouldn't even be. Yes.
Yes. I agree with that, because
people are hush about these topics, and there are
it
things
has to be
that
said.
we experience every day that and it has to be said.
Yes.
So I'm going to look towards bringing you and Dr. Lillian. It's going to be.
That would be a great.
The fire
That would be a
in the
great.
room. The room will be able to contain the fire.
She's another amazing doctor, and I respect her so much.
Okay, so it becomes a concern when it's micro small.
Yeah, when it's
I think that's what
actually
they call it.
excessively small. Yes, that's what it is.
Small and excessively
Absolutely.
Big too.
And if it's excessively big, it's still a problem.
It's on both extremes.
Is exactly that's the point.
Yeah.
That's the point. So that you don't go tearing women's vagina up and down in the name of trying to be acrobatic and all of that.
Shifting somebody's daughter's womb.
It doesn't even happen. There's nothing like shifting the womb. No matter how big it is, you can't even shift anybody's womb.
I mean that's what it's called. Yeah.
Yes, I know. But no, that's what it's called. But many of them actually believe it.
Oh, but people believe that.
People believe that. Yes, they believe that. I mean, listen, I've had a lady come into my consulting room. And she actually said that she had this boyfriend and he shifted her womb. And I just dropped.
Oh my God.
I was just looking at her. That's what she said. I was amazed because I was like, so people actually believe this myth. She said he shifted her womb. I thought it's a joke. She was insisting. She said we need to go into the theater. Let me examine her. That is no longer in the position. As if while I'm still trying to catch that bullet, she now told me she did a scan. That the scan confirmed that her womb was shifted. I thought I'll leave this consulting room for you. I know that you will come and consult. Let me leave the consulting room for you. That a scan confirmed that her womb was shifted. And I always like to explain this out. The uterus, which is the womb, is suspended in the female pelvis by strong ligaments. Strong ligaments. They are like rubber, not this beyond rubber bands. They are strong bands. They suspend the womb in the female pelvis. I don't want to bore you with all their names, uterosacral ligament, round ligament of uterus and all of that. They suspend the womb in the uterus. There is no penis, no matter how big, that can shift. I mean, you're not shifting it to anywhere. This stuff is gallant.
Shifting it to the
no, not shift. Where do you want to shift? Is it to the back or the front? It is standing, it is gallant. These ligaments are solid. That's how God created the female womb. The only thing that can happen is that these bands can become weak over time, not because of a penis, but they can become weak over time because of multiple childbirths. Okay, a woman who has given birth to 5 children and above, the bands that suspend her uterus are going to be weaker than that of a woman who has given birth to only 1 or 2. So multiple childbirths, that uterus has carried different pregnancies. So the bands are becoming weaker. Another thing that can cause it to become weaker over time is chronic cough. A cough that has lasted, coughing. Chronic cough. A cough that has lasted up to 3 months, 6 months. Like you have in TB patients, and all of that. Those kind of coughs can predispose the woman's the ligaments to weakness over time. Chronic constipation.
Wow.
Maybe this person has been constipated for, it's recurrent. It happens recurrently over a long period of time. That can predispose to. But the major factor that predisposes those bands to weakness is childbirth, not penis. You cannot dig it in any way that will make that womb shift. You can't shift it. You don't even have that capacity.
Okay, doctor, duly noted. We shall
So
have
it's important for people to understand
discussion on that.
I'll look forward to that.
Doctor,
It's a nice one.
This next question is very sensitive to me.
Okay.
Like I'm huge on mental health.
Yeah.
So this next question touches on that.
Okay.
Why is suicide rates? Because I did a research and I found that suicide rate in men is 3 times higher than that in women.
Yeah. That's
so
true.
Why is that so? Because doctor, women are more likely to cry. Women are more likely to shout that they are heartbroken.
To let out the emotions. Women let it out more. So, and many times you discover that when you let out that emotions, it reduces the burden. Women talk also. They let it out by talking. They tell you this woman is a talkative, If she doesn't talk, she will die. Remember, rate of depression is higher in women than in men. But suicide rate is higher in men than in women.
Suicide
is higher in men than women. But depression is actually higher in women than men. So women do a lot of talking. Society encourages them to cry. Society encourages them to seek for help. My sister, a man's life is difficult. You see this thing they say, it's not easy to be a man. It is not easy to be a man.
It's not easy.
It is better experienced than told. You get? It is not easy to be a man. You are carrying on a lot of burden, you're shouldering a lot of responsibilities, enduring and absorbing a lot of pressure, and the society does not encourage you to even talk about it or whine about it or complain about it. When you do, the response you meet is, it is your job. Man up.
Be a man.
Are you not a man?
Yeah.
Be a man. And the idea of be a man is you dare not cry. You dare not whine about problems. As if you are not human. As if you're not human, as if you have no emotions. All right? For instance, and you see, this thing is actually ingrained in our idea, in our behavior as a society. It's ingrained in our ideology, in our thinking process. I mean, it was happening to me too. I'm also that kind of person that, I'm just imagining, saw a man, imagine a man walks into my consulting room and he's saying, "Doctor, I'm depressed." You look at him like, I don't understand, depressed. Who is this guy? What's the guy talking about depressed? The man is depressed. It's like, I don't have work to do. But it took my certification in global mental health, which I have from the University of Washington, to actually learn the extent of the impact of depression and other mental health disorders on even the men folk particularly. So society, as it were, is fairer on women in a way. Let me use the word in a way. Okay, because there are many other ways women are actually highly marginalized, all right? But in a way, when it comes to pressure, responsibility, and all of that, you're not expected to cry, you're not expected to complain, just deal with it, man up, handle it, even up to when you're sick. I told you the instant, like this morning before I left for the hospital, I was terribly ill. And the truth is, my wife did not understand the extent to which how ill I was. She didn't. I knew she didn't, because of how much I covered it up. All right. And it's just a complex in you as a man. You don't want to disturb anybody. You don't want to stress. But I was really ill. And I was so ill that I stood up from the bed. I went to the bedroom and I was throwing up in the bedroom. Now look at, because I covered it up so much, she was in the room. All right. She was there in the room, looking across the bedroom door, and I'm throwing up. And she didn't think it was serious. She was like, you know what she asked me? She said, "Are you the one forcing it?" So, but it's not her fault, really. It's not her fault, because I've always been a man. She doesn't even know me to be sick. It's rare. Okay. I know how many times I've treated her since we even met, before we got married and all. But she can count the number of times she has seen me lie down. Oh, I'm sick. Because I'm sick, I still have to stand up. I still have to go to work. I still have to attend to other people. I still have to take care of her. I still have to, that is what a man is expected to do. While I was there, I was throwing up. She said, "Well, is that you the one forcing?" I said, "No, don't worry, I'm okay, I'm fine." I just tried to ease up, throw her off, let her not feel the stuff. I sat on the toilet seat, and there were some drugs I told her to get for me, because we have a drug basket in the house, like a first aid stuff. So I mentioned the drugs, and she went there. She has learned some of those kind of things with time, with time of being with me and all that. So I just mentioned the drugs. She goes and picks them out, and she brought them for me in the bedroom. I was sitting on the toilet seat. I took them there. I just wanted to get a quick fix so that I can stand up and go to work. So the point I'm trying to, make by all of these stories, for a man, it's actually more difficult, because even you as a man, when you consider the responsibilities you have, you will not ask yourself whether you want to sit down and be whining and complaining and forming that you're sick, or you want to go and do work and bring money into the house and take care of your family. You see?
The problem now is on the suicide. They taking their lives.
Because some of them think it's just a way of escape.
Up to the point where they don't, because men hardly, see, they already have issues going to a normal hospital where their body can be treated. They have even bigger problem going for therapy.
Nah, it's not. They won't even dare that one.
Most men won't even. They just keep bottling everything up to the point where they just, their quickest way of escape is just to take their lives and get this thing over with. But women will cry and visit and go to a therapist.
Yes, exactly. Exactly. And like I said, even if they come to the hospital, most men have a problem. Like I said, poor health seeking, attitude. Even if they come to the hospital, they still don't follow up on your treatment plan as a doctor. From the doctor, they don't follow up with the doctor's treatment plan. Okay, I once saw a man.
Good.
Exactly. I once saw a man. I saw a man, and he had I made a diagnosis of gouty arthritis with background hypertension. He's a hypertensive patient, but he came down with this gout, and it was as a result of his antihypertensive medication. All right, so I had to review his drugs. I could tell that was what was precipitating the gout and all that. So I reviewed his drugs and gave him some did all the counseling, lifestyle modifications and all that. Do you know that after that, one of the lifestyle modifications, of course, is avoid alcohol. After that same day, I left the hospital. On my way home, there's a bar close to the hospital. I saw this man seated there with bottles in front of him. So you see, they don't even take this health thing seriously. That's it for men. They don't even take it seriously. They don't complete their drugs. As long as once they are strong enough, you say bed rest. It's not for a man. They don't understand bed rest. They feel as they're lying down there, money is passing, money is going. So they have to go and be part of what is going on out there. Which, if you look at it in a way, you won't really blame them. But in the end, it's taking their lives.
It's still taking their lives.
It's taking their lives, yeah.
They die, even those ones that don't take their lives, they die, earlier than women do. Because that's where we get the mortality rate being higher in men than in women.
Yes, of course, men die more than women now. That's even normal. It's basically men die faster and more than women. I mean, if you just look at the society generally, men take more risks. Okay, there was a study I came across some time ago, and it said that, okay, it was observed that the frontal lobe of a man's brain, okay, because the frontal lobe of a man's brain is of not a man but human beings. The frontal lobe of our brain, both men and women, is the part responsible for judgment and consideration of the consequences of an action and all of those kind of things and reasoning. Okay, that's what the frontal lobe does.
Okay.
But the study discovered that the frontal lobe develops more slowly in boys and men than it does in women. You see that? So what it means is that it shows you why men seem to take more risks than women. Because our capacity to consider the consequences of our actions usually is less solid than a woman's own. And that's why many times you tell you that a woman is more intuitive than a man. Because many times a woman can just perceive danger. She can just perceive something, or perceive that something is not right. But a man, being a logical being, wants you to tell him why. But the woman cannot tell you why. So because of this situation now, men take more risks.
I just feel it.
Is the woman will tell you, I just feel it. And that's why I posted one time on Facebook, I said, any man that doesn't listen to his wife has lost half of his capacity to make good judgments. And I believe that is true. If a man doesn't listen to his wife, he has lost half of his capacity to make good judgments. So, but that aside, so because of this slow development in boys and men of the frontal lobe, which is responsible for judgment, reasoning, and consequence of action, considering consequence of action, men take more risk than women. So you will see more men in car accidents, drunk driving particularly, than women. Women will consider the pros and cons, but the man will just enter, go behind the wheel. You see more men doing car racing or bike racing than you see women doing it. So the risk. Then if we look at the society generally, men take risky, more dangerous jobs than women.
That's right.
Men take more dangerous jobs than women. For instance, how many women have you seen climbing a skyscraper to paint it? In fact, how many women do you see in painting jobs to paint 3-story, 4-story, 5-story buildings? But men will arrange a scaffold and climb to the 7th floor and be painting. Look at another job, for instance, this installation of solar panels. Installation of solar panels. Personally, I don't know. I've never seen. But how many women do you see climbing the roof of all these tall buildings to install solar panels? Do you know how steep those roofs are? I can't try it. I was going on my way to work some days ago, and I was passing one building. You need to see how steep. These modern houses these days, the roof are not so slopey like that. It's steep. The slope is so steep. And I saw solar panels mounted on this roof. So riskier jobs, men take more riskier jobs than women. So these are the reasons why, and of course, health-seeking behavior. Women have better health-seeking habits than men do, like we already discussed. So these are the reasons why men die faster and, earlier than women.
Lucky Nathan says even climbing of mast. It's true.
Thank you. Climbing of mast, all this MTM mast and all that. How many women do you see there? But these are jobs that men will have mind and climb there and go there and do it. So those are the riskier jobs.
It's true.
It's just so those are things that make men die faster than women. Imagine him falling. Do you know how many that fall from there we don't get to see on the news, or we don't get to hear about?
So many.
Many of them, and they just waste and go like that, and that's the end. So it's unfortunate anyway. It's just a man's life anyway. So,
Doctor.
Yeah.
Doctor. These questions are not chronologically listed, so we could be going back and forth on some topics. This one now is about secretions, right?
Okay.
When should men see a doctor as far as secretions are concerned?
When you say secretions, you're talking about the semen seminal
Yes.
fluid, Abby. Okay, what you should
Yes.
see a doctor is first of all, if your seminal fluid or your semen is too watery.
Too watery. Okay.
Yes, it is supposed to be thick to an extent. Every man knows what that means. It's supposed to be thick to an extent. All right. If it is too watery, just very literally watery, you can't find that thick component. It's a cause for concern, of course. All right. Then you want to talk about the color. The color is basically supposed to be creamy, cream. But many times you start having yellow, deep yellow, greenish. What's that? That's a bad sign, totally a bad sign. Then the odor should not be so foul. It shouldn't be foul. It shouldn't be a foul odor, literally. All right. It has its own semen has its own odor. But when you start having a foul odor in your semen, then I mean you have to see a doctor. You have to see a doctor. All right. So that's
Okay.
basically what I would say about the seminal fluid. So the color, the quantity, okay. But it's not a problem if you ejaculate too fast. That's not really a medical problem per se. Some people say they ejaculate too fast. That's not really a medical problem per se. It's more of a psychological problem. Okay, it's more of a psychological problem because
Okay.
sex has to do with your psychology, your mind. All right, so you have to do some more psychological training. All right, and also maybe if you're tense, as it were, sometimes you have this pressure to impress. You have the pressure to impress the lady, or you feel your penis is too small, or all those kind of issues that have to do with your self-esteem, as it were. Those things can make a man to even ejaculate too early. Okay. Or maybe if this man has not
Okay.
had sex in a long time, if a man has not had sex in a long time, he's confronted with sex here. I mean, he's going to ejaculate most likely very early, especially for the first round. So those are basically, yes, psychological problem. It's not ejaculating early is not a medical problem per se.
Chimobi is asking, so should men desist from such jobs?
I mean, if that's what's putting food on your table, I mean, can you desist from the jobs? You can't desist from it. If you desist from it, who will feed your family?
Yeah.
Is it? So basically, I think the thing
Yeah.
is to ensure that you're well trained and equipped for the job. Okay, most of these jobs require
Yes.
a period of training. Okay, depending on the company that's employing you, they will put you through training until they are sure you are qualified enough to handle those tasks. So it's not something you just like for myself that who is a doctor. I just come tomorrow morning and I want to start climbing 3-story buildings to start painting it, or start climbing the roof of buildings to install solar
Village
panels.
people.
You don't see her. You don't see her. So I can't start doing that because I have to go through the training required, yeah, and all of that, and also the right
Yeah.
equipment. So just make sure you're adequately trained and you have all the right equipment to keep you safe up there. People do it, men do it, and they go like the same way you go to work every day. Some people go to work every day, and that's their job. They climb to those heights, do the job, and they still come down and come home to their
Yeah.
family. So I mean, you can't throw it away because it's just like saying I'll quit my job as a doctor because there are health hazards associated with my job. We are exposed to hazards every day, you
Yeah.
know, handling patients
Yeah.
and their products and all that. So you can't. You just have to protect yourself. That's all.
Okay. Doctor, are there health challenges that are peculiar to a man of African descent, like a black man? Are there health challenges that they are more prone to having than other races?
Of course, now there are health challenges that are more prone to that we are more prone to as Africans. Of course, you start with malaria. You're more prone to malaria as an African than, than a Caucasian is. Yeah, that's the truth. You're more prone to malaria. That's the truth. Because it's endemic in Africa, especially sub-Saharan Africa. All right, because of the breeding of mosquitoes and all that. Then even the typhoid, we're more prone to it because of improper sewage disposal, contamination of our waterways and all of that. So we're more prone to that. Even hypertension, our lifestyle makes us more prone to that. We have very poor health seeking attitude or behavior. So that makes us more prone to hypertension, even diabetes, and all of that. So basically, most of the diseases, we are more prone to them in because we are just because we are blacks, and we don't have the healthy culture, healthy lifestyle. Okay, that those abroad do have. So basically, you know.
Okay. Doctor, this one is kind of related to the one I asked of if size, when
Okay,
size becomes a problem. I understand that, yeah, this is not a sex talk, but let's also talk about it a little bit.
it's okay. We
We're
can,
going
you can,
to
yes, you
go
can ask any question.
deeply into it later on. Um, is there a time where the shape of the penis matters? I understand that there are different shapes, but are there times where the shape of the penis, should be a cause for concern?
Oh well, the shape of the penis. The penis basically has one shape, except in cases where it starts bending and all of those kind of things. But basically, penis has one shape. Okay, it has one basic shape, and that's when you have the glans penis. That's the head, or what some people call the cap. All right, the cap of the penis. Then they now have the shaft, the penile shaft. That's the body of the penis. Basically, that's the shape penis have. Then in some people, it will usually go be straight, while in some people it may bend a little, as it were, and all of that. So the shape being a concern, except it is terribly, the shape is obviously abnormal. If the shape is obviously abnormal, and I can't think of any obviously abnormal shape one can possibly have in terms of the shape of a
Yeah.
penis. So the shape of a penis usually is either straight or is slightly bent.
What?
That's basically what you have when it comes to the shape of a penis.
Please excuse me, my light is just
That's okay.
misbehaving.
Mm, it's okay. So that's it when it comes to
We're
the
in
shape of a
Niger.
penis. It's not usually a big problem like that. Okay, it's only that there's a disease condition where, though there's a disease condition where you can have a badly bent penis. Okay, the penis is bent in a very bad shape. Okay, and in the angle of the bend, you have some scar tissues forming there and all of that, thereby impeding erection and all that. But that's a disease condition that is absolutely very rare. Okay, but generally,
Okay.
you have the
So
penis being
generally, there's
straight or
nothing
slightly
to
bent.
worry about.
There's nothing to worry about when
Okay.
it comes to the shape.
Okay.
Yeah.
Doctor, let's talk about gynecomastia.
Okay.
This condition where men have breasts.
Yes.
Some men are
Gyne-
insecure about that. Is it normal to have that?
yeah, it can be embarrassing. It can be embarrassing because women are the ones known to have breasts. So when a man starts
Yes.
developing breasts, it's embarrassing for many men. Okay. So basically, gynecomastia, you can have in gynecomastia, what happens is the glands, there is in the breast, you have the breast tissue, that's the fatty tissues, and the glandular tissue. Okay, the fatty tissue are just the fats around. Okay, in the woman's breast is the fat. The fats are the reason why it is lobe, it is bulbous or round, as it were. Is the fatty tissues in it. Okay, when you press it, it is soft. It's the fatty tissues in the breast. But within it, you have the glandular tissues. It is those glandular means gland tissue. A gland, what does a gland do? A gland secretes. Okay, so it is those glands inside
Yeah.
it or within it that now are responsible for secreting milk. All right, so
Okay.
what constitutes that breast is the fatty tissue, which makes it soft and round, then the glands inside it that produces the milk. Okay, so in gynecomastia, for some men, for most of the men, the major problem is the fatty tissues. Okay, and that is actually a
Okay.
problem mostly if these men are obese. And that type of gynecomastia is actually considered pseudo-gynecomastia. Pseudo-gynecomastia means it's not real. It's not the real
False.
gynecomastia. Yes, false, as it were. Yes, false. That's the word. All right. So pseudo-gynecomastia, that's it, because it's just fatty tissues. And if this man will commit himself to exercising, all right, keeping fit, weight loss and all that, he will probably lose those fat too.
Okay. Oh,
so that's
okay.
considered false
I didn't know.
gynecomastia.
I didn't know it's possible to lose the fat.
Yes, it's possible to lose those fats. But the real gynecomastia is when you have those fatty tissues as well as glandular tissues in a man.
I've seen some men like that.
Yes, glandular tissues that produce milk. And what causes it basically is an imbalance between sex hormones. An imbalance between sex hormones. Yes, because the sex hormones are estrogen and estrogen and testosterone. Women have estrogen, men have testosterone. Estrogen is the reason a woman's body is soft, supple, develops breast, has soft voice, and all of that, has the hips and all that. That is estrogen that causes that. Testosterone is the reason a man's voice is deep, he has broad chest, he has beards, all right, and he produces semen and all of that. Testosterone. But the truth is, men still produce estrogen, and women still produce testosterone.
Still produce testosterone.
Yes, but in very little quantities. If a woman produces excess quantities of testosterone, she will start having male or masculine characteristics.
Start growing beds.
Yes, all of that. Then if a man has excess of estrogen, it can now cause that gynecomastia.
Okay.
Because he's producing more estrogen than he's supposed to have. So that's one major thing that leads to gynecomastia. And this happens basically during puberty or at birth. At birth, it's usually normal to see male babies have breasts. Okay, at birth, because of the estrogen effect from their mother. Their mother's estrogen is what caused theirs. But in that case, within the next few weeks, 3 weeks to 6 weeks, it disappears. The breasts come back to normal. All right. Another place you see it is in puberty. At puberty, that's where these hormones start to gain expression. You get that? At puberty, these sex hormones starts to gain expression. The woman's estrogen starts to produce all the feminine characteristics. The man's testosterone starts to produce all the masculine characteristics. So during this period, if he produces excess of estrogen, he's not going to develop this gynecomastia.
Okay.
But sometimes this can also clear off on its own within 6 months to even 2 years max. It happens. That's during this puberty, between 10 to 14 years for men. Okay. Usually, even if it happens within 6 months to 2 years maximum, it will clear off on it. Everything will normalize on its own. It's just that, that pubertal spot, as it were, that caused it.
Okay.
Yes. Okay. So, but besides hormonal interplay, there are drugs that can predispose a man to gynecomastia. Some drugs can. Yes, some drugs can. Especially antidepressant drugs. Antidepressants will some antidepressants predispose men to gynecomastia. Some anti-anxiety drugs like diazepam, it can predispose men to gynecomastia. Even some drugs you take for ulcer, like cimetidine. Cimetidine has been found to predispose men to gynecomastia. Okay, even some antihypertensives, like calcium channel blocker, maybe amlodipine and the likes, they can predispose men to gynecomastia. So drugs also predispose men to gynecomastia besides the hormonal interplay.
Doctor, we have a question here.
Yeah.
It says, at my puberty age, I had some lump around my nipple area. What could be the cause?
That's puberty. It has disappeared now. It happens in some men.
Yes.
Yes, it has disappeared.
Okay, so though
it happens in some men. Okay. Yes, it happens in some men. Though the only thing is if it persists longer, all right, because it's important to know that men also have breast cancer.
That's the next question here.
Okay, you were going to ask that. Good. So men also have breast
Yes.
cancer. As a matter of fact, in the United States, out of every 100 breast cancer cases diagnosed, one of them is a man. Of course, breast cancer is seen mainly in
Wow.
women, but out of every 100 breast cancer cases diagnosed, one is found in a man. So in 1,000 cases, you have
Wow.
10 men. So there are 10 men having breast cancer for every 1,000 cases of breast cancer diagnosed. So men also have breast cancer, and the symptoms are similar to that of women. First of all, a family history. If there's somebody with a family history of breast cancer in your family, I'm sorry, I say family of family history. If there's a history of breast cancer in your family, it increases your chances. If there's a history of breast cancer in your family, it increases your chances. Another thing is smoking, of course, alcohol. These are things you cannot just.
Hey.
You see, smoking and alcohol, they are a terrible twin. They are a terrible
And they
twin,
go hand in hand.
and they go hand in hand
You can hardly do one and not do the other.
and not do the other. You see, so that's it.
Yeah.
So, breast cancer. If you start having those lumps in your breast as a man, you shouldn't. Even as a woman, that's why you're encouraged to do self breast exam. I even do it for myself. Yes, you examine your breast. It's very important. It's not just the women, men to examine your breast because breast cancer, anything cancer. If you discover it
Anything,
late,
yeah.
yes, if you discover it late, there is little or nothing we can do to help medically. It's only God that can now intervene. You see, so you do the breast exam because breast cancer will always start with a lump. It will always start with a lump, breast cancer. It does not just, you don't just wake up in the morning and tada, you have breast cancer there like that. No. You usually start with a lump. Oh, I can feel this lump. That's why it's important to do a self breast exam so that you will know when it is normal. The reason is so that when it becomes abnormal, you will be able to know as well.
You will be able to
Because if you
know.
don't even know the normal, you cannot identify the abnormal. If you don't know the normal, you
I
cannot
totally
identify the
agree.
abnormal. Yes. So it is normally supposed to be soft, period. No bumps, no lumps, nothing. But at the time you start
Period with a
discovering,
T.
yes, you start discovering a lump somewhere, it means Wahala Pro Max is setting in.
Hey,
So you have to come to the
Wese.
hospital. The same goes for
Okay.
women. You do breast self-exam, make sure you identify. If you see a lump, let a doctor check it out and tell you, oh, this is not a lump, this is your breast tissue. But once you suspect
Dr.
it, go to
Lillian
the hospital.
said last week, she said last week,
Yes.
if you're not sure, go and be sure.
Yes, exactly. If
Don't
you're not sure, go
dismiss
and be
it.
sure. Don't dismiss it by yourself. Very important. Very
Yeah.
important. So once you see that lump, we have to do so we can be taking it out, we can take it out. But when you leave it, it will progress to a harder lump. From there, over the years, you start having pain. Before you know it, you have the cancer. That's the sore now comes out. Before you know it, it starts spreading and the person is going. You see. So
Wow.
that's it with breast cancer. It's very important.
Doctor,
Yeah.
what should men do if they feel pain in their testes?
Oh wow. If you feel pain in your testes, there are two things that could be the reason. Okay. Especially if it is not traumatic. Maybe somebody did not kick you. Except maybe you were
Okay.
playing football and somebody kicked you in your penis, or somebody kicked a ball at it, or something hit you there or something. But if you just stay by yourself and you start having pain in your testes, there are two things.
Please, do they even know
Especially if
what
it is
testis is? Can
okay.
you
Well,
please
let's start
tell
with
them?
that. Yeah, let's start with that. The testis is your balls that is contained inside your scrotum or your scrotal sac. Your scrotum or scrotal sac is the one below your penis. The penis is like that on top there, then the scrotal sac is hanging under it. So inside that sac, you have two balls if you touch it. If your own is not complete, there are reasons for it. I don't know. But it should be complete. It should be two. It should be two. All right. So those two balls, if you start feeling pain in it, especially if it's acute pain, acute means, for instance, you're just sitting down
It
and you
won't
start
go
feeling the
away.
pain. Is increasing intensity. It is excruciating. One major thing that you should think of first, and you start running to the hospital, is called testicular torsion. Testicular torsion is an emergency, and it can happen to anybody
Wow.
at any time. It can be caused by trauma. Maybe they kick you in the scrotum, or kick ball, or something hits you there or something. But it can still start on its own like that. You just sit down like this and you start feeling pain, severe, intense pain in your scrotum. It's an emergency. Look at what is happening in testicular torsion. The blood vessels that supply the testis. Remember, the testis is where your sperm is both produced and stored. Now, if these blood vessels that supply these testes, they, as it were, they are going together, so they twist around themselves. If these blood vessels twist around itself, let me give you an explanation. Something like this. Just a little explanation. This is your testis. This is your ball, your testis. This is the blood vessel supplying it. Maybe there are two blood vessels, artery and vein, and for some reason they now twist around themselves. You see this twist, this kink now. What has happened is that because it has twisted like this, blood flow has been impeded. And this is where that pain is coming from, because there is impedance of your blood flow to that testis. This is where that pain is coming from. If this impediment continues for the next 4 to a maximum of 6 hours, this testis will die. Because there is no more blood flow to it. So that pain you're feeling is your testis screaming out that, oh, they're strangling me. Just like when somebody is having somebody's hands on your throat, you're screaming because you can't breathe. Your testis is screaming, and that's why you're feeling that pain. Help, help, help. I'm not getting blood, and so I'm not getting oxygen, I'm not getting nourishment. If it lasts for the next 4 to 6 hours, this testis will die and go. It means that this particular testis will no longer produce sperm for you again.
Wow.
So
that's why it's an emergency.
That's why it is an emergency, exactly. So the moment you start feeling that excruciating pain in one testis that will not go away, you observe it for the next 30 minutes, 45 minutes, 1 hour. This pain has remained there, is even increasing, is excruciating. It is an emergency. You start coming to the hospital. And
there's one thing. Available vehicle to the hospital.
Yes. Then the second thing you can think about is an orchitis. It's called orchitis, epididymal orchitis, okay, or orchitis means swelling or inflammation of the testis, okay. But usually that one is more chronic. The pain is dull. It starts over a period of time. Then the major way you can differentiate that epididymal orchitis from this testicular torsion is the emergency. Epididymal orchitis is also important to be treated immediately, but it is not as much an emergency as testicular torsion, where the blood vessels twist on each other. Yes. So how can you know? You start feeling this pain. In epididymal orchitis, when you lift your testis, the pain reduces. Or when you rest, you sit down and rest, you sit down. When you sit down, your testis is resting on that chair. The pain reduces. But when you stand and the testis is hanging down in between your legs, the pain is more. You know it is epididymal orchitis. But in testicular torsion, whether you sit down, you lie down, you put ice packs, you do anything, the pain does not go away. That is how to differentiate the two. Testicular torsion from epididymal orchitis. In epididymal orchitis, when you lift it, the testis, when you're standing, you use your hand and just carry your testis up, the pain reduces. Or when you sit down, the testis is resting on the chair. Or when you lie down, the testis is not resting somewhere, the pain reduces in epididymal orchitis. But in testicular torsion, there is nothing you want to do that will reduce that pain. Start running to the hospital, please.
Wow.
It's an emergency. You will be taken into the theater for a surgery and it will be reversed. Yes.
Guys, who is learning something here? Give me that fire emoji. Put it there in the comments. Gosh! I knew we were in for something huge, but I was not expecting to. I wasn't expecting
Something
this
huge.
depth
Careful
of
before
analysis.
Sabine will sue you. Before he will sue you. That's my favorite
Oh my
comedian anyway.
god! Oh wow. Okay. No wonder. Sir, let's talk about itchy groin.
Okay.
What
Yeah.
causes it? What causes it?
Itchy groin can be caused.
Before we
Yeah.
talk.
Yeah.
I went to INEC office the other day. Was it
Mm.
INEC? No, NIN office to get my slip. And where I went to print a paper, the guy there attending to us, oh God, he was just
You guys are scratching and scratching.
he will print out one paper, he will scratch, he'll bring out another one, he will scratch, like his hand was just there.
Can you
Oh
imagine?
my God. Doctor, please, what causes that?
Yeah, you can have itchy groin can be caused by sexually transmitted infections. Okay. It can be caused by sexually transmitted infections, gonorrhea and the likes. You have itching and all that. But most commonly, it is caused by scabies.
Scabies, okay.
Yes, most commonly, it's caused by scabies. And scabies is a disease of dirty people. We have to accept that first. Yes, it's a disease of dirty people. When you have poor hygiene.
Okay.
It's the truth. When you have poor hygiene, okay, scabies will easily come in. All right, you're sharing towels, sharing boxers, sharing underwears with people and all that. It's just
You're sharing
you get
everything
it.
shareable.
Yeah, sharing everything, things that should be private, you're sharing it. I mean, how can you be sharing underwears? How does that even work? How can you be sharing towel? Okay, it's not even that you're a couple. So those kind of things, when you have scabies, cause that's the scabies that is the major cause of that one. You see them scratching public because when the itching starts, it's like they just did it or your mask gets a go. Even you that is scratching it will forget that you're in the public. It is a mad experience. Everywhere is on fire. The whole of your perineum is on fire. You will forget that because you need to scratch this thing like guy. So it's a horrible experience. I've never had a case of scabies in my life personally, but in my line of work, I've been exposed to many patients who it's not a funny thing. That is even in public that the thing wants to disgrace
It's
you.
not funny.
It's even in public that the thing wants to bring you out. You see, and another time you will feel the itch more is at night. Yes, if it's scabies at night, it will wire you. Then also
Why
immediately
now?
you finish having it. It's just the pattern of behavior of the organism. The organism that causes it is called Sarcoptic
Okay.
scabi. It's just its pattern. It's like a nocturnal animal, but in its own case,
Okay.
it's a bug. Okay, it's more active at that time of the night. It's just like some other
Did you say it's a
microorganisms in.
bug?
Yes, it's like a bug, as it were. Yes, you don't know. Sometimes if you yes, in scabies, if you closely examine the pubic region of people who have it, you can actually identify and separate the lice.
Wow.
Yes, you can actually, they are very tiny. You can actually identify and separate them. There's a comb, when you apply the cream, 5% permethrin
Yes,
cream,
that tiny
good, those
comb.
tiny toothed comb. When you finish applying it and they die on that place, because when you apply it, you leave it there. When they die, if you comb through and examine it closely, it's fine. You can see the lice. It happens on the hair too. Scabies can affect the hair. Those bugs
Yes.
can affect the hair, yes, and all that. So it's a crazy thing.
So wait. So does that mean that bugs, the lice the one we call lice on the hair, is also caused by poor hygiene?
Yes, now of course now. Poor hygiene is what
Wow.
basically attracts all of those things. Yes, poor hygiene. Your
I'm
environment is
off.
dirty, your bed is dirty, your bed is dirty, all those kind of stuff. They find it's just like cockroaches. They want to stay in a dirty environment. Many times when you see cockroaches, it's a sign that there's dirt lurking around. So you just have to clean up. All right. So those things are dirt. So that's why sometimes those kind of cases is either you just burn that foam, that's do away with it and set it ablaze, okay, and buy a new one. Because that's the only solution. If you say you want to put under the sun,
Yeah.
if you put under the sun, there's an Igbo adage that says that chinch, that's bed bug, told his children that in Igbo it says iye di oku ga-emecha jụọ oyi. In other words, something that is hot will
Joy.
still later get cold. So if you carry it under the sun, the bed bug, the chinch has already told his children that they should not panic. This sun, leave that matter. That this sun you'll see it will still come down and we will have peace. So relax, leave it. So that sun matter, that sun matter does not really
Oh
work.
my
You
god.
know, it doesn't really work. It's better you just do away with that bed, burn it. That's why, and you see they are migratory in nature. They colonize area. If a bed with bed bug, if they bring it into your house, before you know it, it has started entering clothes. Before you know it has started entering your parlor chairs. Before you know it, it just spreads. It's a useless creature. But that bed bug
So
anyway is
for a
different
man
from
that has that
scabies.
for a man that has that scabies, is it safe to say that he should burn his underwears? You know,
Well,
and get a new.
he may not burn his underwear per se, but he has to observe strict hygiene. Soak them in bleach water and hot water overnight. Okay, if you can
And
afford
even
new
iron
sets,
it.
and even iron it after washing yourself, spread it under direct sun. Then you can apply more heat by ironing. But if you can afford new sets, just do away with those old ones and buy new ones. But the most important thing is to treat yourself. The treatment is what matters the most. Because if you don't treat yourself, you buy new ones, it will still continue like that, you know. Yeah. So
Yeah.
treatment
Yeah.
is paramount in this case. Yeah.
Doctor.
Yeah.
So this is a question. I feel pain when I pee. What could be the cause and how can I treat it?
If you feel pain when you pee, it's not just about feeling pain when you pee. It's medically it's called dysuria. Okay, painful urination. There are it can be caused if it's an elderly person. We can want to look at the person's prostate, want to examine the prostate. But if it's a younger person, we'll most likely be looking at the urinary tract infection. Okay, even a sexually transmitted infection like gonorrhea can still cause painful urination both in males and females. Okay, urinary tract infections can cause painful urinations in males and females. All right, but not just painful urination. We also want to find out what is the color of your pee like. Is it consistently yellow in color? All right, what is the odor like? Sometimes some people, if you pee normally, you shouldn't perceive any odor, but except maybe you're dehydrated. All right, if you're really dehydrated and you pee, you have that conk urine, the odor here. But in cases when you know you've been drinking enough water and you pee and the odor is bad, or maybe you pee into this your toilet, as it were, the water is clear and you pee into the toilet, then it looks cloudy, like water that you put milk into it. And that kind of thing. Those things let you know there's a urinary tract infection. Then also, do you have a lower abdominal pain, both in men and women? There's a mild or dull lower abdominal pain. Do you also have flank pain? Flank pain means your sides here, which will refer to the position of your kidneys. Okay, you have pains in that area. So these are questions we would like to find out from you. Then you occasionally have mild fever. Fever does not mean sickness. Maybe when they hear fever is a sickness. Then fever, no. Fever means high body temperature. All right, when your body temperature is high, that's fever. So do you occasionally have this fever, whether mild or severe fever? You know, all of that to help us to make a diagnosis of urinary tract infection besides a test like urinalysis and urine MCS.
So more like it doesn't, I mean, you can't really say that this is what it is on. No, it's
we'll have to
other symptoms.
Yes, it sometimes most times it works with other symptoms. Yes.
other
So if it's a
symptoms, it
urinary
will be
tract infection,
okay.
if at the end of the day we discover it's a urinary tract infection, antibiotics will do the job.
Okay. Godfrey is asking, can urinating in public places cause urinary tract infection?
Public places, no. How can that? No, it doesn't. Urinating in public places, no.
Okay.
Can't. Not necessary.
Okay. All right. So we've talked already. You've made mention of alcohol and smoking, how it affects the body. So we are not
Yes.
going to go into that anymore. Doctor,
Yeah.
during the COVID pandemic, from my own research, from what I did, from what I read online, it turned out
Yeah.
that men were more likely to contract or catch the COVID-19 than women. Is that true?
That's true. Yeah. It's true. And I think
So
the
does
reason
that
is
mean that
obvious.
immunity is higher in women than in men?
No, I don't think it has to do with immunity per se. Okay. I think it has to do with what we discussed earlier, risk-taking behavior. Okay. In most cases, the man is the one that has to go out to do the job, fend for the family, and all of that. So, because you're the one that has to go out during that period, most women, especially those who didn't have much to do out there, had to stay at home. I doubt if there was any man that even considered staying at home as an option. But for most women, it was an option. Except maybe the man is a well-established person who has his money coming in for him, whether or not he's there. But for most men, you have to go out. So the risk takers, as it were. And being that you're the one that has to go out most of the time, it means you're also the one that has to come in contact with many people. All right. So because COVID transmission has to do with contacts. Okay, that's why they advise the social distancing, face mask, avoid handshaking, and all of that. So it's contact. So the more you go out, and that's why they also say you have to stay indoors as much as possible. Okay, limit your going out. So the more you go out, the more your chances of contacting people, and the more your chances of contracting the disease, as it were. So, and most men are the ones that don't listen most of the times to health advice. Okay, women are like we talked about the frontal lobe that deals with judgment,
Yeah.
reasoning. It develops more in women than in men. So women consider the consequences of the action before taking the action in most cases. But men don't give a lot of thought to the consequences. We just consider the action and dive into it. So all of this is not basically a thing of immune system. It's more of our lifestyle and
Okay.
our activities as well. Yeah.
All right, doctor. So there is this debate online that I've seen,
Okay.
and I'm very curious to know if it is true or not. And that is
Yeah.
that tight underwears cause, over time, cause infertility in men. Is it true or is it a myth?
It's not a myth, though. It's not a myth.
It's true.
It is absolutely true. Yes, it's absolutely true. Look at the rationale behind it. The rationale behind it is, remember, like I said, the testis produces sperm. Okay, testis produces sperm. Some of it are still stored there. Have, have you wondered why the testis is compulsorily hanging outside of the body?
So that it should be
Testis is
it's a stable temperature.
temperature is the reason, exactly. You're correct. So temperature is because body temperature is too hot for your testis. That's why if a child has undescended testis, in other words, either one or both testes remains inside the abdomen and fails to descend into the scrotum, it's a cause for concern. If it is not operated on as soon as possible, what will happen is that testis inside the abdomen that has failed to descend into the scrotum is going to die because of excessively high temperature. The temperature inside the body is not safe for testis and sperm production. Hence, the testis hangs inside the scrotal sac, which is outside of the body. So when you wear tight underwears, what happens is that you are cooking your testis. Especially if it is nylon underwears. If it's cotton underwears, it has the chance for air to move in and out.
Ventilation.
Nylon underwears, yes. Nylon underwears trap heat. Nylon underwears, they trap heat. So it cooks the testis. This is another reason why this sauna bath is not advisable for men, especially spending a lot of time inside that hot water bath. If you spend a lot of time inside it and you do it too frequently, it is not so advisable for men. That's another reason why drivers who engage in long distance driving, it's a problem. Because your testis is sitting in between your laps there for most of the day with all the heat. And some of these cars where the engine is directly under the driver's seat there.
Yes, yes.
All those heat and all of that.
Yes.
So if this is this man's major preoccupation, this is the major job that brings food to his table, it means he engages in it every day. For most of the day, he's engaging in it. You will see that this testis is being actively cooked. So over time, the testis will start dying gradually. It's called atrophy. It will start atrophying. So less and less portion of the testis is now available to produce sperm. And over time, the whole of the testis may not be viable enough to produce sperm, and it predisposes the man to infertility. So that is why when couples come for infertility management in the hospital, the men must also come. It's not just women. We've gone past that era of there's no child in the house. It's a woman's fault. Nobody's having that conversation again.
Yeah.
Okay, because 50% of infertility is caused by men. And the major cause is this, what they call it, low sperm count. So when the man comes, one of the questions every doctor will ask you is, what kind of underwear do you wear? Is it tight or is it loose? Is it cotton or is it nylon? We'll also ask you the kind of job you do. Are you a driver, long distance driver? These are important. The reason we ask is because we want to know where your infertility issue is coming from. So the answer to that question is yes. Tight underwears will predispose men to infertility. Not women, men to infertility. So it's not a myth, it's a reality.
Duly noted, guys. I hope you took note of that. I'm glad to know the answer finally, because there are so many responses. Some would say no, it doesn't. Some would say it's good. I'm glad to hear it from a doctor. Now, second to the last question that I have here, doctor, is that is how much sleep should men have? Men don't. It still boils down to the responsibility.
Yes, men don't sleep. Don't get enough sleep.
Responsibility on their head. Yes, how much sleep should, on average, should they have?
You see, the issue with sleep is not a gender-specific matter. It is every human being. The average adult should have no lesser than 6 to 7 hours of sleep every day. If you can get 8 hours, sleep it. You see, because we have a lot of motivational talking going around the internet, and we don't even know what to
sleep for 2 hours a day.
I'm telling you, the great men sleep only 2 hours a day. The great they sleep only 4 hours a day. You now sleep 6 hours. You now be as if you be feeling judged, like it's like this greatness matter. It's like
it's not for me.
It's like it's not for me. There was actually a time in my life I was plagued by that mentality. Yes. And I will stay awake throughout the night. I will be reading or writing or doing one thing or the other. In my head, I'm telling myself that I'm being productive. And in the end, I have only 1 or 2 hours of sleep. And I use it to brag that last night I slept only 2 hours. I was so busy with work and all of that. You are dying. You are just dying slowly. Because you see, there's a lot sleep does for you. Sleep refreshes you. Sleep revitalizes your organs, your body cells.
Revitalizes.
Yes, it gives
Yes.
your brain the time to rest. Your heart beats slower when you are asleep. In other words, your heart finds some time to rest too. During your
Rest.
waking time, you are working, you are busy, so the heart is beating, to meet up with all those activities. Now you're sleeping,
Yeah.
there's less activity. In fact, there's zero activity. So the only thing your heart is doing now is to pump blood to vital organs to just keep you alive. So it doesn't have to beat to meet up muscular function or brain activity, mental activity,
Yeah.
or whatever. No. So your
Ooh.
heart still has some time to rest.
Yes.
So all of these have a healing effect. You have to rest.
On the
Great men
body.
sleep 4 hours. Are you in their house? Do you live with them? Did you count their sleeping time? Are you telling me that Dangote never slept for 8 hours? People
Why
like
now? Why
Femi
should he sleep for
Otedola,
8 hours? He sleeps for
people like
2 hours only.
that. Let them go and copy him and know if they will make the kind of money he's making. Easy. People like Femi Otedola, I follow many of these billionaires on Instagram, okay, because I like their lifestyle. That's kind of, I think in that fashion, all right. So I follow a lot of them. Femi Otedola, Bill Gates, Dangote, Mark Zuckerberg, Elon Musk, and all of them. I follow them on Instagram, on Twitter. I try to see what they say, what they do. I want to understand how they think, all right. But people like Femi Otedola will always post when he's on vacation and all that. Vacation, he's not working. He's sleeping, he's resting. He just sleep,
It is
wake up,
sleep.
eat,
Oh.
go to the beach. His guy is just living his, and you see him fresh every day. You
Yeah,
see,
so
so
man, that man is fresh.
yes, they are fresh. Look at Dangote. Dangote is only how old? How old is Dangote? About 58 or something, about 55 or 56.
Yes.
The last time I checked, he was celebrating his
Yeah, around
54th birthday. That was about 2 years
thereabouts.
ago or so. So they're about 55, 56 now. But he's still looking cool. Yes, he has a few white beards, but that beard thing comes sometimes. It's natural for some people. Okay, so you never can tell if it's natural for him. But he doesn't look sick. He still looks agile. He still looks healthy. Whether you like it or not, he cannot have that level of health without adequate rest. He will just break down.
Yes.
He
Yes.
will
And
just
and
break
it's
down.
also good for mental health.
Yes, for mental health is also good too. Getting on, you will just run mad though. If you don't
Doctor, we
sleep
have a
well.
very funny comment here. He says,
Yeah.
a time like that, I didn't sleep for 3 days. It was people around me that noticed that I was already running mad and had to put me to sleep. And I ended up
So you
sleeping
see,
for 3 days.
you can imagine. So if you don't sleep well, it's actually called insomnia. It's a medical disorder.
Insomnia, yes.
Yes, it's a
Yes.
medical disorder. So sleep is important. Excuse me. Sleep is important. You cannot do without sleep. It helps to refresh your whole system. All right. It helps to refresh your whole system. And I mean that goes a long way in keeping you healthy and alive. So there are those stories of a great man does not sleep too much. Well, yes, it doesn't. We are not saying you should sleep the whole day, because if you sleep the whole day, who is going to put your pills? But what we are saying is make sure you get enough sleep daily, 6 to 7
Yeah.
hours, at least 7 hours. If you even can see 8 hours, sleep it is not bad. I was watching one video and the guy is a multi-millionaire in dollars anyway. This Steve Harvey, you know. So I follow him
Okay.
on Facebook, Steve on the Watch. So I watch his programs and all of that. He's a
I follow him
multi-millionaire too.
too.
Yeah, he's an amazing guy. So he was doing some analysis of if you sleep 8 hours a day, by the time you're 50, you have slept half of your life. You would have slept for 25 hours. I mean, 25 years. I said, my brother, allow me to just be alive first. Calm down. You understand? We will be
Yeah.
hardworking. See, being in Africa alone, what is Africa? Being in Nigeria alone is a risk factor for many diseases. You see, being in Nigeria alone is a risk factor
Yeah.
for so many diseases. In fact, somebody said when you want to write your work experience, add being that write that you're a Nigerian is a work experience.
Oh no.
So you cannot be there in New York, you know, enjoying all the good amenities and all the goodies of life. The government is practically taking care of you. You know, you don't need to put in as much work as we are putting in over here to make ends meet. Food is way cheaper over there than it is here. With $1, you can eat a good meal. $1 here is how much? 500. A plate of food, they will tell you it's 300 naira. And inside that 300 naira, you don't even know what you bought if you're looking for the food. So, so I say you cannot sit down there in you cannot sit down there in New York and be telling me that if I sleep for I need that 8 hours or 6 hours of sleep so that I will be, for my mental health, for my sanity, you know, for my overall well-being. That's the truth.
Doctor, this person is asking, how do one determine a loose or tight underwear? Is there a guideline?
No, there's no guideline. If it is loose, you will know it is loose. If it is tight, you will know it is tight. Loose means it should just be free. Your penis, your scrotum, your balls, they should have freedom. They should breathe. They should be able to breathe. They should be able to move around without hindrance inside your boxers. Free it, yes. They should be able to move. Some people, I don't know why they have that complex. Some people are at home in their own house. They are wearing boxers and knicker or boxers and trousers in your house.
Yeah, I wonder.
You see what's going on? I mean, this is my house. I'm going out, I can wear boxers, then wear my trousers. But I mean, in my house, I can't be wearing boxers and still wear knicker or whatever. I wear my boxers and move around. If it's only me and my wife that are around, that are together.
Some will wear brief, wear boxer, wear knicker.
Wear knicker. You're cooking that test. Allow it to breathe air. Yes, you're just cooking it. So if that is your routine, you have a problem. So loose means your penis and your testes should just be free to move and jingle around inside your boxers. If what you're wearing does not permit this free movement, then it is tight. You shouldn't be wearing it. Yeah.
Doctor, we have a question here. He's asking, is putting cell phones in the pocket close to the groin, is it a health hazard?
There was a time it actually rained that, okay, the electromagnetic waves, okay, because when all these phones, you know, they emit electromagnetic waves and all of that. So put it in it. If they say if you put it in the breast pocket, it can even cause breast cancer. If you put it in the trouser pocket, it can even cause cancer of the penis or infertility and all that. Well, all of that has, even some people now said they're the best ways to use earpiece. Don't even put the phone in your ear. Otherwise, you have ear cancer and all that. My dear, all of that have been debunked by science, okay? By the technology experts and all that. That all those, the electromagnetic waves are not strong enough to cause, the ones coming from your device, your phone, is not strong enough to cause cancer, okay? It's not strong enough to cause cancer, both of your testes or your breast or anywhere. The waves is generating. The one that is strong enough is the one coming from the mast. That is why it is not advisable to have a mast around those residential areas. Yes. It can be in the areas where you have offices, you know, you come to work and go, but residential areas, and I see a lot of things happen around. A mast is standing and houses are around it. It is risky. Some people even use it to collect money from MTN. They will give MTN part of their compound to put the mast. MTN will pay you 10 million. Or pay you 30 million or 20 million. It's your life they just gave you in terms of money. It's your life
they just bought.
They bought your life. They gave you your life in terms of cash. So, but the one coming from your device is not strong enough to cause any bodily harm. It has been proven. So, use your phone.
Okay.
Yeah.
The final question for tonight, Doc. We've spent 2 hours plus here. And it's just fireful all through. Gosh! It's such an honor to have you here, Doctor. Thank you for doing this.
It's my pleasure. It's my pleasure. I've absolutely enjoyed being on this show.
The final question we have here is...
I saw somebody talking about the price of the food, 300 naira a plate and all that.
Yes.
That 300 naira a plate is just mama put. That mama put and mama put.
It's just mama put now.
If you want chop well,
it won't even be enough.
It will be enough. If you want to eat well, we pray to spend at least 1,000 to 1,500. Okay, that's you want to eat well in that mama put. Then if you now want to throw your money away, you go to all those eateries You're talking about from 3K, 5K, and above. So all those ones are
Mm.
just base level.
Doctor, can we finally talk about the heart,
Okay.
right? The heart, cholesterol, hypertension, just these three. I know they are interrelated. Can we talk
They're
about
interrelated, of course.
cholesterol? What leads to high cholesterol? You know, hypertension. How men can take care of their hearts more?
Yeah. First of all, let's say what leads to that high cholesterol: eating a lot of fatty foods and eating a lot of refined sugars. Okay,
Okay.
eating a lot of fatty foods and eating a lot of refined sugars. If you eat a lot of fatty foods, the excess of it will go and deposit in your blood vessels. That's the cholesterol. Okay, a
Okay.
lot of refined sugars. When the excess sugar has been stored in your liver's glycogen, the excess can be converted to fats and deposit in your blood vessels as well.
Okay.
Okay, so when you eat a lot of all these fatty foods and refined sugars, it deposits in your blood. It converts to cholesterol at the end of the day. And the problem is that it goes and deposits inside your blood vessels, just like it happens in that diabetes, that the glycated
Yes.
product, the glucose product deposits in blood vessels. That's what cholesterol does. It also deposits in blood vessels inside, thereby reducing the caliber of the blood vessel. And when the caliber is reduced, blood flow is impeded. So an organ that was getting 5 mils of blood is now getting only 1 mil of blood, or even 0.5 mils of blood. So you see that that organ is actually being shortchanged. All right, it's being shortchanged. And so the nourishment and ventilation the organ was getting is no longer going to be getting it. You're going to expect problems. So this is another basis for hypertension, because now it has deposited in the arteries especially, and there is increased peripheral resistance. Increased peripheral resistance means this blood vessel has these deposits of cholesterol inside it. Blood flow is reduced. So the heart now is doing a lot. Before, the heart will just pump. It will just pump, boom, and blood will pass through that vessel. But now that the caliber is reduced, the heart has to do a lot of work because the heart now is trying to pump that same 5 mils to that organ. Because the heart knows that that organ requires 5 mils. So when the heart pumps pump like this, it will send 5 mils with ease before. But now you're eating a lot of fatty foods. Some have deposited in the blood vessels, reduced its caliber. The heart now is looking for a way to still send the same 5 mils. So in order for that to happen, it cannot pump pump and the 5 mils will go. No. If it does that, only 1 mil is going to go. So now the heart is increasing its workload. Boom, boom. Before it was pumping, boom, boom, boom. It's getting, but now to get 5 mils across to that, or otherwise that organ will die. So to get across, it's now doing boom, boom,
Ah,
boom. You are
poor
increasing
heart.
the workload on the heart. You see that? Because there's now increased peripheral resistance. So the workload on the heart
Wow.
has increased. That's how you now have hypertrophy of the heart. In other words, and cardiac enlargement. They said the heart is enlarged because the workload is increased. Why was the workload increased? Because of increased peripheral resistance. There's now resistance. That heart usually pumps pump and the blood will go through. Now it's now pumping boom, 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 boom for that blood to pass through. It is stressing the heart. So when you check that person's pressure, the blood pressure, it is high because the heart is using more force to pump blood through. That high blood pressure is what we call hypertension. See it.
Okay.
So it's all related. So how do you care for your heart more? Of course, cut down on the fatty food. Please, very important. Cut down on the fatty food.
Examples of
Cut
fatty
down.
foods, because when we say fatty foods,
Yes, fried foods. Fried
fried
foods.
foods.
Because
Thank you for mentioning
these
that.
days, almost
Fried
everything we
foods.
eat is fried.
Yeah.
Nobody wants to eat anything that is not fried today. I also love food. I'm a foodie. So when I go on Instagram or Facebook Reels, okay, I watch all this food preparation and I cook too. I enjoy cooking though. So I enjoy all those videos of cooking and all that. I like watch. I save some of them. Sometimes I tag my wife on them even, or I save some of them and all that. Sometimes I come back home and try some of those kind of stuff out and all that. But you see that almost everything is being fried. They bring
It's
shrimps,
fine.
you
And
fry
now,
it.
doctor,
Yeah,
some of them are even frying with butter. Butter
with butter.
already.
Thank you. We are still
God.
frying with butter, or we are frying with groundnut oil. The thing is, sometimes we even do deep frying where we have to dip it inside the oil and it absorbs oil. Then we bring it out and we chew it and we say, oh, so yummy. So yummy is your heart that you're yumming down there. It's your heart you are yumming. That is the truth. So, so as much as possible, limit your frying, limit your use of oil. And some cultures enjoy using a lot of fat, a lot of oil. This Benin, I'm in Benin. I'm currently in Benin. That's where I live. Benin, that's Edo
Yeah.
State and Delta State. They
Okay.
do with a lot of oil. I've worked in Delta State. I'm working in the Edo State, and I noticed that many of their dishes, especially when you come to their stew, then in Delta State you have this banga rice. Oh my God! I don't know whether it's peculiar to the mama put I used to eat from there, no. But I knew that at least two or three mama puts. There's even some people that were pushing wheelbarrow and passed then in the hospital I was working years ago. Then the woman will carry it and come, my God, come and see oil. Come and see oil. Then in Benin here, you see their stew. There's no point. Half of the pot is tomatoes, half is oil. So I don't know
What?
what's up with the. It's too much. I don't know what's up with the oil. So those, I think, is a cultural thing. So all those oil, it boils down to cholesterol, and your heart suffers in the end. So cardiac, to keep cardiac care, cut down on those fatty foods, fried foods, your use of all those butter and all the rest. Then of course, work out daily, very important. Working out daily will help. And when we talk about workout, as little as 10 minutes every day, as little as 10 minutes. And what is 10 minutes? You wake up, let's assume you wake up by 7 a.m. From 7 a.m. to 10 minutes past 7 is perfect. The most important thing is be consistent with it. If you can be consistent with it, even in 1 month, that's 30 days, you can see sizable results. So just be consistent with it.
Because there is saying, but it's the quantity of the fat that matters. The fats have their own role in the diet. What can you say about that?
What work? You should answer. What work is the fat doing for you in your diet? Okay, fat, yes, fat and oil is a class of food, but when it's excess, that is the issue. Yes. So that's why we said
Chances are
cut down.
that you're already even getting enough from the little that
From the
you're
food
already
you're
getting
eating.
enough. Yeah,
Yes, from the food
yeah.
you're eating. Okay, foods like granite already contain oil. Okay, some meats already contain oil by themselves, and that's why I like this.
Yeah.
There's this fryer that they do advertise on TV and all that,
Yes, that
of
doesn't fry
this
with oil.
air frying or something like
Air
that.
fryer, yes.
And that's
Yes.
that's really amazing. It's quite expensive. I think about 70K for the set, or I don't know, I can't remember. But that's really amazing. Air frying, and without the oil
Yeah.
and all of that. So, well, oil does not have much it's doing for you. You can literally do without it, because most of the foods you have around you
You
contain
already
those
have
oil
enough.
in the quantity.
Like,
It's just like
yeah.
some trace elements, okay, like iron,
Yes.
zinc, manganese, all those things. Your food, your daily food already contains those things. So going to look for supplements, just like people that binge on supplements, you ask them, they say they are taking supplements. You don't just take supplement as a routine. Supplement is not food. You say you're boosting your immune system. How do you know your immune system is low? Told you that it's low first. So many of those supplements you're going to binge on, live on them, is your daily this thing, is contained in your food. So that's how it is for fat
The
and
final
oil. Those
question
excess
here,
are not
doctor.
required. Yeah.
The final question. At what age should a man start checking his BP? I think that is I think that is
It's a
clear
good
enough.
question. Oh, it's a good question. You can start at any age, but at least once you
At any
clock
age.
30, you should start checking. Yes, but at least once you clock 30, you should make it a routine. Check it at least
But
once a week or
I saw the case of a young man, I think that's 25, and he didn't even know that he had hypertension until he checked his his blood pressure. I
his
saw it
blood
was
pressure.
about
Yes,
200 and something, and he didn't even know.
there are things that let's not forget that there are other things that can predispose a person to hypertension. Okay, there's a disorder called pheochromocytoma. Okay, it's like a tumor of the adrenal glands. The adrenal glands are situated on top of the kidneys. It's a small gland. When there's a tumor of that gland, it's called pheochromocytoma, and it can cause high blood pressure. You get so. Such a person should be investigated further. It's not just okay, we found that his blood pressure is 200 over this. We have to investigate this person further to be sure that there is no underlying risk factor that's predisposing to it. Because ideally, at 25, it's not really something you should be bothered about. You see, so if you're having renal failure, patients with renal failure, patients with renal failure can one of the symptoms is hypertension as well. You see, so the person has to be investigated further. All right. So, but like I said, you can start at any age to check. It's not bad. It doesn't harm. You see, like that
Any
guy now,
chance
if
you
he didn't
get, you
even
can
check,
check your
if he didn't
blood
even check
pressure.
at 25, he wouldn't have known. And if he's
Yes.
investigated further, you will be discovered that there's something else causing the hypertension, and you'll be taken care of. So, at any age is
Yeah.
okay. But if you're 30 and above, make sure you check it at least once a week or once a month.
Because many men are afraid of even checking their blood pressure.
They're afraid of
I know
checking. It's just
someone
like,
that doesn't check. If he goes to the hospital and his blood pressure was to be, he doesn't allow it. He
and
said,
it's
"I
bad
put the check
because
now," and if it is 180, he will now start. I said, "But it's better to know if it's 180 or not, or
and
200,
that
so
is
that
the
you know
the
what to
problem with
do."
those kind of people is that if they have hypertension, they are now a ticking time bomb.
Yes.
Yes, those are the things that cause sudden death syndrome. Sudden death syndrome. This person is hypertensive. First thing they'll tell you, oh, none of us follow chop yesterday night now. None of us follow drink yesterday night now. All of us gather watch football yesterday night now. By this morning, they tell the person slept and didn't wake up. Because all along, this person has been hypertensive. All along, this person has been hypertensive. Or maybe you now have a quarrel with this person. Only ginger, no, you are just gingering. I will show you, I'll deal with you, I'll deal with you. The person just collapse.
Yeah.
Everybody will gather you and say, you said you would deal with this person. And as far as we are concerned, you have carried through, you have seen you've carried out
Yes.
your threat. So, but we will not
Yes.
know that this person has been hypertensive, and this activity, this intense activity triggered the whole stroke and everything. So these are the things that cause sudden, or the person will just wake up in the morning, come to his car to go to work and slump there. He will slump there, and that's the end. Some people there are many cases in our line of work. We hear many cases. Okay, some people with a man ahead of the other day. He looks healthy, at least that's what people say. Drove his car to the car wash. He got there where they would drive. He drove it, entered the car wash. Then they were waiting for Morga, come down and may we wash your car. As he opened his door, he just collapsed and fell out of the car.
What?
And as I speak with you, he has been buried long ago. He was buried 2 months ago, 3 months ago. Okay, 2 months ago.
Hi.
So these are the things we are talking about. If you don't check it, you will not know. And
If you
if you
don't
don't know,
check, you
you
will
will
not
not
know.
access proper treatment. The person will not die suddenly, and they will say he died suddenly. The person
But
didn't die suddenly. Something caused it,
yes,
and the thing was
something caused
neglected
it.
for a long time.
That's been
You
overlooked
see that?
over time.
Yes, it was
Yes.
overlooked or neglected. So you must check. It's just like this HIV. Know your status. We keep talking about it, but people don't want to check. They want to, yes, you want to check. Your heart
God
is beating.
forbid.
Your heart
That's
is
what they
beating.
keep saying. It's not my portion.
Your heart is beating and all that. When you want to check, the counselor will say, sit down. When you want to collect yourself, you say, sit down. They will not start talking to you. They will say, you see, HIV is not the end of the world. Okay, give me my result. That's the point here. Just give me so, but the point is, your heart is beating, but you still have to check. You still have to
Yeah.
know. So that if you
So you
know, you
know.
start taking, yes, you start taking your drugs and you live a healthy life, just like every normal human being. If you take your drug every day, finish. It's not easy, but you have to do it. That's the sacrifice. So you should know. You should know. Shying away from me. Some people think it's when they know that's when the sickness becomes serious. It's a lie, oh. Whether you think it will become serious or not, the sickness is the sickness. It has its pathophysiology or its pathogenesis, sorry. And that pathogenesis is the cause of the disease. Whether you know or you don't know, it will play out its course, okay, and arrive at the end stage. If the end stage of that disease is death, that person will still die. If the end stage is a chronic disability or whatever, the person will still have it. So it's better to know and help and treat yourself better.
Please, how dangerous is inherited BP?
It's as dangerous as acquired BP. As dangerous as long as
Just the
that's high blood
management.
pressure anyway. When you got BP means blood pressure. Everybody has blood pressure. There is a normal blood pressure, 120
High
over
blood
80.
pressure, yes.
Yeah, so it's high blood pressure we're
Yes.
talking about. So it's as dangerous as acquired high blood pressure. You have to take your drugs every day, and you have to
Modified
observe lifestyle
lifestyle.
modifications. And those lifestyle modifications include, if you're hypertensive, you must reduce salt intake. If possible, cut off salt from your diet. When you're cooking food at home, when they want to put salt, they remove your own and put other people's salt. Other salt.
Mm-hmm.
That's I'm talking about if you're hypertensive. Hypertensive, cut down your salt intake, cut down your fat intake because it will worsen high cholesterol will worsen your hypertension. All right.
Yes.
Remove alcohol from your diet completely. No more alcohol. Of course, if you smoke, that goes without saying. You must remove your smoking completely. All right. Eat a lot of vegetables. Vegetables have been known to help with blood pressure control, especially green leafy vegetables. Green leafy vegetables, very important. Fruits also are good as well. Then, of course, your drugs will be taken every day. Every day. Don't forget your checkups, your regular checkups. Every doctor that is managing for hypertension will give you checkups. It may be monthly, it may be 2 monthly, it may be every 2 months, sorry, maybe 6 months, every 6 months, and all that. Okay, the moderate exercise helps too. I said as little as 10 minutes every day. Many times, this exercise is not about doing it, you want to do 10 hours or you want to do 30 minutes every day. If you start out with something unrealistic, you may not be able to follow it through. So 10 minutes every day is perfect. You'll be fine.
Woo! Dr. Newton, thank you
Yes,
so much,
so
guys. We have come to the end of this show. Please say something to Dr. Newton. Tell him thank you very much. If you got something from this section, I'm sure you got something. So let me see your fire emoji in the comments so that I can highlight all of them. My God,
mhm.
it's look, you had everyone spellbound all through. This
Really,
is the show. This is actually the live show that we had the most number of people still watching, even after
wow.
such a long time. Yes,
I thought they would have all left
yes.
safe.
Same here, but we still have 8 people watching. And YouTube is not like Facebook where someone would just come and go, but the person is just opened the YouTube app and is just watching.
Yeah.
Thank you very much, you guys. Please say something to Dr. Newton. Let me see your fire emoji, please. That's what I want to see. Someone is saying, God bless you, Doc. God bless you very much
Thank
for
you.
coming here
Thank
to
you
share
so
your
much.
knowledge. Thank you very, very much. Thank you. It's been just amazing. It's been expository. It's been everything, everything. It's just
I'm
been
happy to do.
amazing. Thank you, Doc. Thank you. See the
You're
fire
welcome.
emoji.
You're welcome.
Thank you very much.
Pleasure is mine.
Gazelle Demba is saying thank you, Dr. Newton. We
I
love you
can see
so
them.
much
Thank
and
you.
hope to have you soon, soon. Yeah,
I
that
look forward to
sexual
that.
talk that I talked about, we are going
I
to
look
have it with
I look
Dr.
forward to
Lillian.
that too. With Dr. Lillian. Yeah, I look forward to that. I look forward to
Thank you
that
so
too.
much. Thank you. And we apologize for keeping you for this long.
No, it's okay. The
We
pleasure is
apologize to
mine.
your
I,
wife
I
for
like
keeping her
sharing
husband here
knowledge. Yeah.
too.
I like sharing knowledge. So
Thank you.
it's my pleasure. I'm glad to be here. I'm glad I had the opportunity to share with you people.
Thank
Thank
you.
you very much for
Thank you.
having me.
Thank you. Do have a wonderful night rest, Doctor. And we'll
Yeah, I
see you
wish you the
soon
same.
next time.
I wish you the same. Thank you very much.
Bye.
Bye everyone. Yeah.
Yes, sir. Woo! Oh my God, that was something else. That was just everything I expected and more. I learned so much. It was just eye opening for me. So many things that I thought I knew were just debunked, and he told me I didn't know anything. And I'm so glad I did this, and I'm very happy that many of you are still watching. Thank you very much for joining. We've spent 2 hours 39 minutes here, and you're still watching. It shows that you have faith in what I do. and that you found what I'm doing here very, very impactful and interesting. Thank you for being with me. Thank you. Tribers, you are the best. And next week, we have a very wonderful topic coming up. It will be just you and I. We're not going to be having any guests. All right. So it's just be you and I talking and, like the old times, getting to discuss some serious issues. And next week, we'll be talking about those of us that are supporters of others and critics of ourselves. Believe me, it's going to be fireful. It's going to be huge. Jennifer Funaya, he already answered that how dangerous is inherited BP. Where were you when he was talking about it? He said it's as dangerous as acquired BP. You just have to manage it well, just like you would acquired BP. There's no difference. The only thing is that it can be passed on to children, your offspring, but really, it's the same management that both inherited and acquired BP um, require. All right. Olabisi Victoria says, I'm not giving up on studying medicine again. Oh, that's so sweet. Please, if you found this session impactful, I want you to copy this link and share with your friends, share with your people. Let them come and watch. They need to know what we are doing here. They need to see, they need to get this knowledge. This is not knowledge that you get everywhere. You see, I had to work with medical practitioners to do this. I could have gone online, gotten my answers, and come here to share with you. But I knew that there are differences, between someone who just went and did the research and someone who studied this. And you see how he was able to bring up different scenarios and examples that are very relatable to our everyday lives, right? So thank you for being here. I i absolutely loved doing this with you. I loved hosting you for this session and this episode. I'll see you next week. Until then, be good, be kind, be gracious, be compassionate, and be a lot less judgmental. Okay? I love you, and I'll see you next week. Same time, same station, 9 p.m. on Thursday. We are coming live again. Okay? So don't forget to share this video. Don't forget to like the video if you enjoyed it. And don't forget to subscribe if you haven't. And I'll see you next week. All right? Bye for now.